Sit anywhere you want. It's all your stuff. One of town's one of your fellow speakers. You guys are on the same panel. I'm not handing out anything, so I'll try my best. I can't make any promises. I am. Yeah. Hello? Testing, 1, 2. Good morning, everybody. We're going to have to start rolling. We've got a lot to do today. So, good morning, everyone. It's an honor to welcome you all to the 47th Legislative Breakfast on Mental Health. I'm Max Shafir, Chair of the Legislative Breakfast on Mental Health, and I'm thrilled to be here with so many of you. You all are change makers within our community who have a long-lasting and important impact on policy change, service delivery, and the quality of mental health services provided to citizens all across our great state. This year's theme, Navigating the Evolving Landscape, Resilient Strategies for Mental Health and Transitional Housing, Substance Use Programs, and the Tailored Plan, highlights the dynamic and critical work we're all engaged in. As we continue to navigate these shifting landscapes, it's essential that we come together, share ideas, and focus on building resilient strategies that will ensure mental health services are accessible, effective, and sustainable for those who need them the most. Before we dive into today's important discussions, I want to start off by offering a big thank you to Valerie with the NASW of North Carolina for doing such an amazing job each year with registration and for their continued support of this event. But their contributions don't just stop there. The NASW of North Carolina also plays a critical role in lobbying for mental health issues and ensuring that the voices of all of us are heard throughout the state. Through their work and their collaboration with the North Carolina General Assembly to advocate for policy changes that directly improve mental health services and outcomes across our state. Their ongoing dedication makes a profound difference for us all. Let's give them all a huge round of applause. Over the past 15 years, this breakfast has grown tremendously, becoming one of the leading mental health collaborative presentations across the state. We've expanded to include an even broader range of participants, mental health associations, providers, insurance companies, clients, legislators, and other stakeholders, coming together like never before. This event has become one of the largest of its kind, and this growth is due to the incredible dedication of the people in this room and those joining us online. You are the ones making sure that these important issues stay relevant within our communities, and your commitment is what drives this event forward each year. During these difficult times, with so much conflict around the world, within our own country, and even right here in our own state, mental health has become more critical than ever. It's a nonpartisan issue, and it takes all of us joining together as a community to solve the mental health challenges that have drastically increased during and after the pandemic. These challenges are real, and the need for action is urgent. But I have no doubt that with this collaboration of people in our audience, online and across all sectors and political divides, we can make a real difference in addressing these pressing mental health issues. As transitions in mental health occur throughout our state this year with Medicaid expansion, a change in our governor, and new legislators in both the House and Senate, 2025 is going to be a great year to inspire the change we want to see and improve the state of mental health in North Carolina. On that note of hope and change, let's now hear a brief message from our new North Carolina Governor, Josh Stein.
Good morning. I'm Josh Stein, and I am honored to be your governor. I want to thank the Legislative Breakfast on Mental Health for inviting me to join you all today. I regret not being with you in person, but am pleased to be with you by video. You all have been leaders in the field of mental health advocacy for nearly 50 years, and it is wonderful to see your legacy continue. I also want to thank all of the elected officials, medical professionals, experts, and advocates who will be attending and presenting today. In North Carolina, far too many people struggle with mental health issues, nearly 1.5 million North Carolinians. I've sat with too many families whose lives have been ripped apart, either by mental health challenges or drug addiction or both. Hearing those stories has made this issue intensely personal for both Anna and me. And it's clear that it will take all of us to combat this crisis. I'm grateful to be part of this conversation focused on improving outcomes for those living with mental illness and for their loved ones. Medicaid expansion was a huge victory for our state and will help many people get the care they otherwise wouldn't get. We're also leveraging nearly $1 billion in federal incentive payments to strengthen our mental health care system. But there is so much more work to do to get more mental health care providers in rural and low-income communities, invest in more community-based care, and empowering our schools to provide preventive and early intervention services. My wife Anna has been long an advocate for people struggling with mental health or addiction issues, and she has made destigmatizing these diseases and lifting up our people one of her top priorities as First Lady. And she is going to be a fantastic advocate. Together, all of us are committed to ensuring that every North Carolinian has the resources and supports that they need to live healthy, fulfilling lives. We cannot live up to our promise of opportunity for all until we ensure that people living with mental illness have access to the health care that they need and that they deserve. I look forward to continuing to work with you all to destigmatize mental illness, eliminate service gaps, and improve treatment services. To everyone in the room who's worked to serve mental health patients across our state, thank you. Your commitment is changing lives, and it inspires the rest of us to do our part. Together, we will build a North Carolina where no one has to suffer in silence, where those in need can access the high-quality care that they deserve. The health and well-being of our people depends on it. Thank you all so much.
Thank you, Governor Stein, for that message. Before we continue with today's event, I'd like to take a moment to express our gratitude to our planning committee that creates this entire event that you see before you. Let's also give a big thank you to the Friday Center staff for creating the atmosphere that we love so much. And of course, let's give a very big thank you to all our sponsors that help fundraise this entire event. Their generous support enables us to come together and continue making a meaningful progress in the mental health field. You will see them listed on the back of your programs and displayed throughout our website. Please join me in thanking our title, platinum, and gold sponsors, the NASW of North Carolina, NAMI North Carolina, WellCare, UNC School of Social Work, Easter Seals Port Health, North Carolina Association of Public Community Health Plans, Blue Cross Blue Shield, and WakeMed. Let's give them all a round of applause. As we move forward today, I encourage each of you to engage in the discussions and share your insights on how we can collaboratively build resilient, sustainable strategies in transitional housing, substance use, and the tailored plan to strengthen mental health care. Now, before we jump into the jam-packed event we have ahead of us today, I do want to quickly mention that we're moving at a fast pace. So if you need to use the restrooms, too bad. But in all seriousness, I know that we're ready to get started. So with that, it's my great pleasure to introduce someone who has been a tremendous advocate for our community. Former Senator Mike Woodard has been active in community affairs for over 30 years, including leadership roles within North Carolina JCs, his church, and a variety of local and regional groups. He has done an amazing job during his tenure with North Carolina General Assembly, and we have never had a more joyful and comedic MC for this event. Please join me in welcoming Mike Woodard to the stage.
Look who's back, back again. Shady's back, tell a friend. Look who's back, back again. Sorry. Good morning. It is great to be here once again, proving either that good help is hard to find or that your steering committee has a great sense of humor and has not tired of dad jokes or hair jokes. More on that later. Good morning, and I am pleased to welcome you to the Friday Center for the 47th Legislative Breakfast on Mental Health. I've been to many, but I haven't been to all 47, but I'm closing in on half, so that's still pretty good. Today we're going to hear from mental health experts from the academic world, direct service providers, and individuals with lived mental health challenges. My former colleagues in the General Assembly will engage in town hall style discussions of questions submitted by you, the attendees of today's event. Before we go further, I'd like for us to pause for just a minute to remember someone that we lost recently, our great friend, Representative Joe John. Joseph Robert John Sr. passed away on January 20th at the age of 85. And while we know Joe was 85, he never acted 85. But as many of you know, Joe served in the legislature, he served in the judicial branch of our government, and also the executive branch, one of the few people to serve at the highest levels of all three branches of our government. He was a great friend of all things health-related and mental health, and an advocate for so many other things. Let's pause for just a moment and remember Joe John. Thank you, Joe. May you rest in peace. At this time, I'd like to invite all the elected officials who are here, anybody at the federal level or members of their staff, our colleagues from the state level, and as well as our critically important local officials. Please stand and be recognized by the audience, all of our elected officials. I started coming to these breakfasts as a city council member, and I know how important all of our local folks are too, so we are so grateful. I saw them scattered around the room. So thank you to town council members, county commissioners, school board members, and all of you at the local level for all of your efforts to make our towns, cities, counties, and of course the state of North Carolina supportive places to live. Presenting an annual event as big as our legislative breakfast takes time. A lot of volunteers, cash, of course, or gifts in kind, and not like Super Bowl ad kind of cash, which we'll be subjected to all day tomorrow, but have you checked out grocery prices lately? So I hope you all enjoyed the eggs today. So that's why I particularly want to be sure that we thank our sponsors, visit their tables, notice who they are. Is this thing supposed to keep moving? Because I think I touched something, so I don't know if somebody can get it rolling back. But anyway, Please be sure and thank all of our sponsors for stepping up and helping out, especially with the eggs, this morning. Visit their tables out in the atrium, and again, just be sure to thank them. Again, the National Association of Social Workers, NC Chapter, the UNC School of Social Work, Easter Seals, NAMI, WellCare, the North Carolina Association of Public Community Health Plans, Blue Cross Blue Shield of North Carolina, and Wake Med. I want to thank our planning committee. Max, Linda, and the whole team on the planning committee make my job so simple, and it's the reason I keep saying yes, getting up early on a Saturday morning, even in my retired status, to come and be with you all. So let's get everybody who served on the planning committee just to stand up for a minute, and let's thank them. Y'all please stand up. If you all could see behind the scenes the work that goes into putting this together, I usually come in at the tail end, but even then, I'm copied and involved on so many emails. It's just an incredible amount of work. Before we hear from our two secretaries today as our keynote speakers, I also want to pause for a minute and thank all the folks who work at the Department of Health and Human Services. The secretaries get recognized, but there are so many people who work so hard behind the scenes in the Department of Health and Human Services all the time. So if you work for the Department of Health and Human Services or have in the last few years, please stand and let us thank you, all the DHHS employees. God bless you all. We could not do what we do without your support in Raleigh or wherever you're based and traveling all around the state. When Secretary Stein nominated Dr. Sangvi to be our new Secretary of Health and Human Services, I was very pleased because I know Dev and his great work. But then I realized, I said, wait a minute, I won't be able to do hair jokes anymore. You know what I mean? So, but you see, Dr. Sangvi, those of you who have attended in recent years, the root of my introductions go back to the hairy days of the pandemic when our hairstyles were looking a bit gnarly, except for Cody Kinsley's. However, we're lucky enough to have two keynote speakers today, and I get to introduce Secretary Kinsley for one more time to take my cut or whack at him. Cody Kinsley is no stranger to us in the behavioral community field. After negotiating the waves and curls of the federal bureaucracy, Secretary Kinsley came home to DHHS to serve as our Deputy Secretary for Behavioral Health, and then Chief Deputy Secretary for Health, which included his incredible work as operations lead for the COVID response team through those days. When Secretary Cohen left, Cody was a lock to become the head guy at DHHS in 2022. His main job was to lead North Carolina's expansion of Medicaid. And another of his crowning achievements included the securing of $835 million in new behavioral health funding. And thank God for that. But I need to cut this short because you'll hear more about Secretary Kinsley later. For now, let me just invite our great friend of behavioral health, a great leader in all things health related, our former secretary and a great friend to all of us, Cody Kinsley.
Well, good morning, everyone, and I'm so happy I will not have to hear those hair jokes again. few things. First, recognizing all the DHHS staff that stood and all the other government employees that are out on a Saturday spending time in the community and working. Turns out that regardless of what some people believe, government workers do work more than 40 hours and around the clock. The number one question that I have received since being here today and over the last few days has been, can you guess? Why do you have that mustache on your face? And I was really hoping to distract Senator Woodard with the mustache and give him a different hair thing. But we just got to try different things. In all seriousness, I thank my mother for my hair because it's really hers and just one of the many wonderful gifts that she gave me that I'm so grateful for. Okay, moving on. Thank you all so much. It is wonderful to be here. And when I started to think about what I was going to share, I started to think back to my first mental health breakfast in 2019. At the time, I was Deputy Secretary for Behavioral Health, and I had not been long on the scene here in North Carolina. I had come home in 2018 after leading the Treasury Department's operations and financial work there, and I had this background in kind of government tech, healthcare tech, government operations. And, for this community, it was a little bit odd to have this guy that was talking all the time about operations and systems and data and money, but you all welcomed me. I think we spent a lot of time talking about how do we improve the operations of our behavioral health system. How do we try to make it more effective so that there aren't as many cracks when we try to serve folks? How do we get more value out of the resources that we have? How do we make it truly a system that is joined within our healthcare system broadly? But we also talked quite a bit about money and the need for more investment in this system. I remember at that first breakfast, my challenge to this group, and something that I have continued to challenge us, is how do we do this together and not apart? This community gave me the mantra of nothing about us without us. Say it one more time, nothing about us without us. And yet sometimes this community historically has not lived up to that mantra. That in a desire to focus on our issue that matters most dear to us, galvanized by the trauma of our personal experiences, those late nights when you've struggled to find care for the one that you love most, or those moments where you felt like you have turned every page and scoured the state and can't find the support that you need, has made this community sometimes so focused on the most proximate issue in front of us, whether it be, and I always start to list out all of Kelly's acronyms, SMI, TBI, DD, SUD, and we start to fight amongst those acronyms about who's getting more and why is that dollar going there and why is this dollar going there. And I challenge us to say, you know what? We are not the enemy. We together are strong and capable of understanding that actually the enemy is all of us. The enemy is that as we stay focused on just what is only in front of us, we will continue to create a system that does not serve all of us. And that we had to look past that and understand that our chief challenge was fighting stigma, was trying to push back at the belief that mental illness is a moral failing, and that indeed it is a medical issue, that social connection with others is foundational to our well-being, and that not an afterthought, but actually the key to what could make whole person health possible. But to get there, we had to work together to proclaim, not sheepishly, but confidently, that behavioral health is not just an afterthought, but it is essential to health. And that we had to strike a careful balance. Because I understand that there is a balance between focus and division. That we can lift up an issue that matters and lean in, but we don't have to exclude others from it to get there. We can say, here's how you fit in. This is how we prioritize this and get this done. One of my greatest regrets from the COVID pandemic experience was that we did not come out of that shared experience as a people, as an American people. I believe we did not come out of it with a deeper understanding that your health impacts mine, that you and I are in this together, that in some of our darkest moments we could come together and do amazing things. We focused on the issue only right in front of us, the mask. We got mad about someone telling us what we had to do or this or that, when we were all, frankly, washing our bananas because we had no clue what to do. And as we Ouija boarded our way through the dark together, we saved lives. We never overtook the ICU beds. Our healthcare heroes worked up, did miraculous things. We rolled out vaccines faster than many other states. We exhausted the capacity that we had. Vaccines that had taken decades to develop for other diseases came on the scene within a year. And now this disease that was novel to us, our bodies have within us the ability to fight it when we start to get sick. A transformational victory. But understanding that my neighbor's health and well-being could impact mine, or the fact that the person who works at the front desk of the grocery store at Food Lion at the checkout counter is just as important as the person working in the healthcare office. I feel like we divided ourselves a bit more, and we're living with that reality now. But the silver lining, I think, in that experience was that we did come out the other side with, I believe, a shared appreciation of mental health and well-being. That everybody experienced fear and anxiety, either in their hearts or in their children's eyes, with a deeper understanding that connected them to how important mental health and well-being is. And we leveraged that connection. We leverage that deeper sense of empathy to really drive forward a strategy to unlock the potential of mental health in this state. And it could not have happened, friends, without all of you, without the fight for the last 47 years, for one conversations at a time, for the stories that you have bravely told to people about what needs to be done, bearing your soul to get there. I'm ignoring these lights, I promise. I'm kidding, Max. And we've gotten there. We have made huge transformations, and there is still so much more to do. But some key folks that really made this possible are our legislators here today. If I could have a huge round of applause for them. Because they didn't have to. It was a tough moment. There was a lot of division and a lot of frustration. And the fact that they ran to an issue that is so nonpartisan, an issue that truly uplifts people and helps heal people, is one of great, great moral strength and moral courage. And I am particularly thankful to my very good friend, Senator Jim Bergen, with whom I bonded very quickly at the beginning of my tenure, way back when I was the weird ops guy, over a shared love of mental health and making a difference. And together we traveled the state. We went to 14 mental health town halls, inviting state legislators to come together to make a difference on this issue, and we got it done. And most people will think about Medicaid expansion as being transformational. It certainly is. Most people will think about the pilots. Most people will think about the $4 billion in medical debt and the things that we got done at the department over the last several years. But the thing for me that will always be the most meaningful will be what we have done on mental health. Not just the investment, but the policy changes, the tailored plans, the 988 launch, the push for justice-involved populations to unlock the power of destigmatizing these communities. This has been amazing. And the reason why it is amazing to see is because it was the voices of those moms at those town halls who were between their moments of tears talking about how they couldn't get care, come together with everybody else, and their words were prophecy to become truth and deliver to the policy changes that needed to happen in our state. Thank you so much. Thank you for letting me be a part of your journey. Thank you for the amazing work that you do that needs to keep happening. I'll leave you with advice. Continue to engage. Don't fall victim to the calls for division. It's hard to hate up close. Remember the value of public servants. Don't don't call people out, call people in. Remember that we created this system and we can change it. We are so lucky to have in my successor, Secretary Sangbai, a person, as we think about the moment that we are in, a person who understands intricately how hospital systems work and how they are motivated, a person who understands in the personal relationships with patients how to communicate with them and how to connect them with the whole person care that they need, someone who in their free time decided to also get a law degree and understand deeply the interaction of the legal system with the health system, something that this community knows more than most. He's going to need your help. I am going to support him 100%, and together we will continue to transform this system. Please welcome Secretary Sangbai.
That is a tough act to follow. So I completed my 4th week on the job on Friday, and I can say honestly it's been incredibly exciting, and dare I say it's also been fun. And part of what's made it exciting and fun has really been the phenomenal legacy that Secretary Kinsley is leaving not only within the department but state government. And I was thinking to myself, Cody, you got Medicaid across the finish line. You got us $1 billion for behavioral health. You figured out what we need to do around medical debt. And I said, all right, I'm going to go and focus on workforce. But then someone said, nope, Secretary Kinsley and the Secretary of Commerce put together a commission around workforce. So he had Medicaid, behavioral health, workforce, medical debt. He's got height, he's got hair. I'm like, could you please leave something for me? But honestly, he's left quite a lot. I mean, he's helped us have this. That wasn't supposed to be a joke, but now I get that. Yeah. You know, he's left this phenomenal foundation, and now it's ours to build upon. So I want to take a moment and thank Secretary Kinsley. We all know him for everything he's done publicly, but privately, a scholar, gentleman, and absolutely a statement. So thank you, Cody. I also want to take a moment to thank the breakfast for this wonderful opportunity, for Max as well. When he said, would you mind saying a few words? And we're at the Friday Center. I said, all right, I'm from academia. It's Friday Center. You got to give me slides. So I have slides today, I promise. It's not a lot, only about 3 or 4 dozen. No, it's only about 3 or 4 slides. But what I'd like to do is really take a moment and talk a little bit about my connection to the important work that you do, and then share a little bit about what's a early developing vision. And I was telling my team if we could put a draft watermark across all these slides, I would like to, because this really needs to be developed with each and every one of you. All we can do is come up with the ideas. What we need from this community is to say, how do we take those ideas into action? So I want to share a little bit of a background on myself. And I want to start with the state of affairs. And so as you look at some of these titles here, these are from newspapers and other clippings, I think we all know what these mean, and we've all kind of experienced them in one way or another. And if you squint hard enough, you'll see that these are actually titles from the 1990s. And what it really shows us is as much progress we have made, we still have a lot of work to do. And this is when I entered into healthcare. It's when I entered into the behavioral health space. I was a medical student in the mid-90s, and these were the conversations we're having. And I remember my psychiatry rotation. You know, as a medical student, you go through various rotations. And I remember during my psychiatry rotation actually hearing about things like, I can't afford my medications. For those of you who do prescribing, some of those medications we use now regularly, which are generic, weren't generic. So I can't afford my medications, Dr. Sangvi, help me do something else. And it got me into this idea, and it made me familiar with the idea that whole person health is so critical to what we do. And it's been a huge part of what I focused on in my career. So I've had the luxury of having a 23-year career at Duke, and as I think through the variety of things that I've had an opportunity to do, I was excited to see that TROSA is one of the sponsors. One of my early opportunities around this idea of whole person health was to think about how do we put a clinic on TROSA's site. So we put together a clinic to help individuals in TROSA say, we're not going to allow you to think about your needs in the context of substance abuse without actually thinking about whole person health. I spent about 15 years in the eating disorder community and had an opportunity to meet with and work with a number of individuals, several who are here today. So it's great to see some friends. And then most recently, before taking this job, was president of Duke Regional Hospital, where I spent about a decade on the board before becoming president, thinking about how we're going to improve our commitment to behavioral health. And then during the pandemic, we opened the behavioral health hospital at Duke Regional Hospital, which is thriving and growing. So I'm excited to bring that experience, but most importantly, to use that as really parenthetical information as I learn from each and every one of you. So as I think about what I've learned, none of this is foreign to anyone in this room. But I think it's important that we stress some of the things that we see here. We know that the workforce is absolutely critical to get this work done. And on the next slide, I'm going to share with you some of my early ideas or thoughts on where we need to focus. But we know that the workforce is stressed. We know that burnout is a reality. And we know that the shortages are going to have impact or having impact on all of us. I think we've all seen the graphic or the map that you see here in the bottom of the slide. I want to draw your attention to central North Carolina. As you notice, Orange County is not a shortage area, and then just to the east, where Duke is a shortage area. So I thought to myself, how can this be? And it's important, I realize that geography matters, but I thought, how can where UNC is at not have this level of shortage, and where we have Duke located have this level of shortage? I said, that cannot be real. There's no way that's real. And then finally I said, we got to let UNC have a win somewhere, so we'll let it slide. Sorry. All right. So I knew that I was going to get that response, so I'm going to recover. I'm going to recover here. I was fortunate to attend a reception before we started today and heard from Dean Ramona from the School of Social Work. And as many of you might know, or some of you might know, part of the most that I've learned about the importance of behavioral health comes from my wife, who is actually is a social worker, who has been a part of the UNC system for over 20 years. So I have my foundational learning on what's so important in the world of social work and mental health actually comes from the great things that have happened here. And she often reminds me, you've got to say more, because she was working when I was in school. So yes, UNC did pay the bills. Okay. She didn't want me to put that out there, and it's on record. But this is the environment we're in. So how are we going to take what we have and actually do something about it? So again, draft watermark, imagine it on top of this, but these are some areas that I think we want to focus on. One of the things I'm committed to is strengthening access to all North Carolina communities. And there are a number of areas that the department needs to focus on, but I think what's particularly pertinent here is some of the access challenges we have at our state-run psychiatric hospitals. We have the bricks and mortars. We have the beds. We don't have the people. But if we can find a way to increase capacity there, I know we can help with some of those incredibly heartbreaking stories we hear about kids lingering in emergency rooms. And in some cases, kids sleeping overnight in DSS offices because we just don't have capacity. So the way we're going to build capacity is find a way to open those beds. But as you know, you just can't fix one part of the system because there's a push, pull, and tug in other parts. So that has to come with doing all the work that Cody had talked about earlier, that we had heard about earlier, in building that foundation at the community level so communities can manage what communities can, jails can manage what jails need to manage, and then when we need the expertise of the state psychiatric hospitals, we can tap into that. So that's one of the areas I want to focus around access. I want to draw your attention to the bar on the right, ensuring our programs and services are working for every North Carolinian. We know we need to fix our child welfare system, and we know everybody is working tirelessly to try to figure it out. It is strained and it is challenged. But I go back to the example I gave earlier. We cannot have children lingering in places where they are actually decompensating because we think we're helping them. This is a zero-fail system, and we are going to have to move to zero-fail. And I'm so empowered by the reality that everybody feels the same way. As I've gone into with our General Assembly members, well, there's two things I hear. One, I hear how Cody was so awesome. Are you going to be as awesome as Cody is? And then the second thing I hear is how important this is for everyone. So I want to actually take a moment and once again thank our elected officials who have given this issue priority, but we are going to have to become a zero-fail system when it comes to the kids in our state. Finally, our two other real comments. I think the work that we've done around Medicaid is foundational. It's important for what we need to do to move forward. We increased what we pay many of you to do that important work that you do. And for so long, that has gone unrecognized. One of the things that you may have seen on the first slide I showed was the need for parity. We've been talking about it for 30 years, and finally are starting to make some progress on that. So I think that's one of the other things. And then finally, I want to close out on this issue of workforce. And I want to focus on an important term here that you see. We all talk about workforce, but I think the important word here is sustainable. We have got to stop looking at how we fix our workforce challenges as we have a vacancy somewhere, let's fill the vacancy and move on, and look at reducing our vacancy. We have to figure out how we make careers in behavioral health, careers in the mental health space, careers in state government, careers that support and help people, the type of careers people want to go into. And this is about career development, it's about creating trajectories, it's about creating sustainability. And I'm really excited because not only do we feel this at DHHS, Governor Stein feels the same way, the Department of Commerce does, Department of Corrections, and so many others. So I finally feel we have that collective wisdom to say, how are we actually going to look at workforce from a sustainable perspective? So those are my comments. I don't have a whole lot other than to say thank you again for this wonderful opportunity. I also want to say hi to those members of DHHS that stood up, because I haven't met you yet, and so I hope I get to meet you. We have 19,000 people in the department, so not sure I'm going to get to shake every hand, but I do want to say thank you to the incredible team that we have at DHHS. I'll end with a story that I think, for many of you, it's going to seem like, yeah, that's kind of common, but for those who are not as intimate with this work, I had an opportunity to go to Western North Carolina a couple weeks ago. And if you hadn't had a chance to go to Western North Carolina, go. Spend some money in Western North Carolina too when you go, because that's going to be important for the economy. And then just take in the level of destruction that you see there. Despite the phenomenal cleanup efforts, there is still so much physical destruction there. And in that setting of hopelessness and destruction, I had an opportunity to meet with individuals from the Mitchell County Department of Social Services. And I attended one of their meetings, and they were talking about the stories of the experience that they had when there was no power, no cell phone, no water, and no sewage. And every single story focused on the client. Now think about that for a moment. You're worried about your own house, you're worried about your own road, you're worried about your own livelihood, and each and every single one of them was talking about how we serve the client. So when people ask me what inspires me to do this work, it's that. If we have individuals who are willing to take risks themselves and say the most important thing to me is that my client knows that they're safe, then I know I can do this work with each and every one of you. So thank you, everyone. I appreciate being here. I'm looking forward to the conversation. I'm going to turn things over. I'm going to turn things over to Senator Woodward to continue. Thank you, sir.
Did y'all watch the Grammys last week? No, yeah, it's an older crowd. I get it. Yeah. So just in case you know, whether you're pulling Beyonce or Kendrick or Chapel Roan or Charlie XCX. Do y'all even know who some of those folks are? You should go watch Janelle Monáe, though. She killed it doing the Michael Jackson, don't you think? Well, and we have the Oscars in a couple of weeks, so we're right in that cusp of award season, but we're not going to let you down. We got plenty of awards today. So, and I've been assured that everyone is wearing appropriate clothing on the red carpet, so anyway. So we have a few awards to present, some folks to thank. So I would like to invite back to the stage Secretary Kinsley and Senator Sidney Batch for our first award.
I didn't plan to do a costume change for the awards ceremony. Oh, so thrilled. Okay. The Representative Paul Lupke Legislative Champion on Mental Health Award honors the late Paul Lupke, who was a tireless advocate for improving and expanding mental health services in North Carolina. He worked with fellow members of the North Carolina General Assembly and community advocates to educate us all on the critical need for mental health services. This is a storied award, one that this crew knows well, and you know the recipients well because they've all been here and they have fought for mental health for a long time. Names like Verla Insco, Tamara Behringer, Tommy Tucker, Floyd McKissick, Josh Dobson, Carla Cunningham, Jim Bergen, Mike Woodard, and Donnie Lambeth. These are amazing leaders. Let's pause for a moment to give them a round of applause. Joining that cadre of amazing leadership and accomplishment, I'm honored today to introduce the 2025 recipient, Senator Sidney Batch. Senator Batch represents Senate District 17 in Wake County and serves as the minority leader in the Senate. She brings her background and skill set as a social worker and attorney to advocate for essential services for residents across the state, including vulnerable children and their families engaged with social services, critical services to support maternal and therefore family health and well-being policies that also encourage the success for small businesses. Please read more of her very long and storied biography on the website because we're short on time, but most of all, just get to know her. She is a wonderful human being who pours her heart into everything she does, especially when it comes to children. Please join me in welcoming and congratulating Senator Batch.
Good morning. I hope all of you are doing well. It's a really great honor to stand before all of you and to receive this award. Today, mental health is finally taking the stage where it should be, and all of you know that all too well with all of the individuals that you work with every single day in our communities who are frankly walking around extremely broken and scared with a lot of anxiety and needs. And I would also just say, many of you know that I do a lot of work in child welfare. I'm a family law specialist and a child welfare advocate and a social worker. And so I spend a lot of my time steeped in the foster care system and what needs we have with mental health. What I want to do in dedicating my time in the short time that I have in front of you is to just thank you all for what you actually do. Because at the end of the day, with I would say 85% of the clients that I've represented over the last 20 years in our court system, the vast majority of women have been sexually abused and have been neglected and have never gotten the help that they actually need when they were children. And then they become adults and they walk around without the skills and without the therapy and without having been healed from all of the traumas that they never asked for. So they walk around this earth and they are literally, as some of you have heard, walking around bleeding on people that did not cut them. And what we need to do and what we are tasked to do as a legislature is to figure out evidence-based research and money, actual money, to invest in a system that is broken so that we can go ahead and fix the harms of individuals that did not actually ask for that trauma. And so today, I thank you all for everything that you do in this space, because it's really hard. When I got into elected office in 2018, one of the things that I always was told was, don't talk about the fact that you go to therapy. You'll never get elected. You'll never get elected. Most of you know, if you've talked to me, that I talk about my therapist probably 10 times a day. And I encourage everyone to go to therapy. And actually, Senator Bergen and and at a mental health breakfast, a mental health roundtable, of course, with Secretary Kinsley and also Senator Bergen, I talked about my therapy, and I talk about it openly because I think it's really important for us to destigmatize it. And I joked with him, and he goes, wait, you go to therapy? I thought the legislature was your therapy. I said, the legislature is why I'm in therapy. We handle and deal with really, really massive issues, and we feel the pain of so many that are hurting. And so what I tell you guys today is I thank every single one of you who stands in the breach, stands up for and advocates for marginalized communities and for people who honestly are just looking for help, and you guys are doing that. So while you guys are helping me, and believe me, and all of you therapists in here and clinicians should know that if you're a good clinician, you're also in therapy, because you are holding space for all of us, and you need that help. And so as we go into the next 4 years with a really, really, really challenging landscape, including many of you in your organizations who don't know if you're going to have funding today or tomorrow, I want to just let you know that we appreciate you, we thank you, and that there are legislators in a bipartisan fashion here today who are advocating for you and advocating for your communities, your families, and the children in our state. And when you find yourself planted in the dark and looking around, what I want you guys to remember is that perhaps you are actually the light that many of us look to in order to get through the darkness. Thank you very much. And now I have the absolute and great honor of actually presenting the Lifetime Achievement Award of 2025, which is actually a rare award that is not given out every single year. And I get to do that to my dear friend and colleague, Senator Woodard. The Lifetime Achievement Award is not presented every year. It shines special light on individuals whose career and public service span many areas of the community needs and interest, and who have dedicated time and talent to improving life experiences for residents in all corners of North Carolina. In 2022, at the 44th Legislative Breakfast, former Representative Verla Insko was the first person to receive this honor and recognition. Senator Woodard is just the second. Senator Woodard exemplifies what a public servant is, someone who seeks to improve and uplift people he doesn't even know personally, but who he says are his fellow brothers and sisters, whether they live in small towns, big cities, or those in wide open spaces of natural beauty and enjoyment across our state. His career experience in healthcare delivery with Duke University, I won't hold that against him, and the Duke Health System, his service on the Durham City Council, his 13 years at the North Carolina General Assembly, as well as countless volunteer hours supporting local, regional, and statewide civic organizations and projects, illustrates his ongoing and longtime commitment to making North Carolina a fun, safe, and enjoyable place to live, raise families, work, and grow into the people that we all know North Carolina and North Carolinians can be. I have the great pleasure of having served with him for the last few terms. And what I can tell you is that in a building that is steeped in a lot of political polarization and chaos, he is always in a position where he works in a bipartisan fashion. He does not get angry. He obviously uses his levity and his great sense of humor in order to get through really difficult times down at the General Assembly, and he's never in the front trying to take credit for it. And so it's a great honor for me to, of course, award my friend and my colleague this Lifetime Achievement Award. Senator Woodard.
Nope. Wow. Sydney, thank you. I'm actually touched. That was very, very kind and far too generous. And I would like to thank the steering committee for this honor. Just getting awards for doing what I love doing and what I think is important. You don't do it for that. You do it because you're helping people. And I was just sitting there thinking about so many of the people over the years with whom we've worked on behavioral health things. Sarah and I have a great friend who lives in one of our sheltered programs, and we've just had so many friends who've we've helped through behavioral health issues, and that's what it's about. And the chance to get to do this for a number of years and to work with so many of you as I look across this room is very, very rewarding. So thank you. These Lifetime Achievement Awards kind of sound like a eulogy, though, like, you know. But let me assure you, I ain't done. And so I'm actually glad this is a clock so that it's actually useful and not just hanging on a wall somewhere. It's beautiful. I think they saw that clock in my office at the General Assembly, and that's what they want if you ever see my clock there. But anyway, so this just tells me that time is still running. So I'm not even changing lanes or anything like that. It's a race that we're running, and for me, it's just one more lap. And while I may be passing a baton on to some of the others of you, I'm still running the race with you. So stay tuned. I'm just lacing up a new pair of track shoes, and we're going to keep running this race to continue providing incredible behavioral health for all the people of North Carolina. So thank you very much. I wear my orange tie for my friend Jim Bergen today. He is my favorite UT volunteer. So anyway, he is a Tennessee graduate, and I don't hold that against him. In fact, I celebrate it today. So I'd like to invite Senator Bergen up to the stage to present our next award. Thank you.
Mike is a dear friend, and I miss seeing him every day. Folks, it's wonderful to be with you. This is a great crowd, a big crowd. It's my honor to be up here to talk about my friend Cody Kinsley. It's not just anyone who qualifies for a whole new award. A new award? A whole new award category at the legislative breakfast, but Cody Kinsley fits that criteria. I'm pleased to be presenting to him the first Legislative Breakfast Outstanding Acts of Service Award. During his tenure at the Department of Health and Human Services, he was focused on a range of essential services to improve quality of life for North Carolinians of all ages. Following his appointment as Secretary in 2022, he was especially focused on expanding Medicaid to all who qualified, and with the support of the General Assembly, that became a reality for over 630,000 people. They put 600, but I get a number every week, so 630. His legacy at DHHS is built on three priority areas: behavioral health and resilience, child and family well-being, and building a strong and inclusive workforce. In his remarks here this morning, he demonstrated again his ongoing commitment to assuring fair and accessible health care for all residents of North Carolina. You can read more about Cody if you go to the Legislative Breakfast website. But I want to talk just a minute personally about Cody. He was right. Our first meeting, we talked about mental health and both of our commitments to mental health, and from there began a journey for many years. And all of you know we traveled the state, we talked to a lot of people, we traveled a lot, different times. We flew out west right after the tragic event out there. And in talking to people and spending time together, you form bonds and friendships that'll last forever. Now, a lot of the biggest question I've been asked is, what's Cody going to do? And so I took it on myself, and I'm not going to tell the story. I'll let him tell the story. I've already lined up something for him, and he can share it if he decides to. But so don't worry about Cody. He's going to eat well and be taken care of. So. But Cody, you're a good friend. You're great at what you did. You're wanting to get up here. I know you're wanting to get up here. Come on up. Come on up. Everybody, join me in honoring Secretary Cody Kinsley. Oh, we got to do this. We got to do this. He's had to hear this like 14 times, but I'm going to say this again. One of my favorite sayings, if your presence doesn't make an impact, your absence won't make a difference. Cody, you made a huge, huge impact, and we will miss you. Thank you.
I'll be brief because you're tired of me. Senator Jim Bergen, thank you so much. I appreciate your friendship. The job he's lined up for me is at Popeye's Fried Chicken. He's given me 2 shirts, so it's an aspirational opportunity. I have both the line shirt and the managerial shirt. And my first job was as a sandwich artist at Subway, and so, I have to learn the fry grease, but I think I can get through it. The person who this is really for is the person who has supported my mental health, who's been at my side for the last over 10 years. I'm so grateful for him, especially for the last 3, my partner, Angela. Thank you.
Okay, let us get to some of the meat of today's program now with our panels. The theme of our panels today is navigating the evolving landscape, resilient strategies for mental health and housing, substance use programs, and tailored plans. So the remainder of our program this morning is divided into 2 pillars or subject matter areas. The first pillar, our first panel, will be talking about transitional housing, and then our second pillar will be substance use programs. So what I'm going to do is invite the members of the first panel, transitional housing, if they'll transition by coming on up to the stage here. And while they're taking their seats, I'll point out that the biographical information about each of our panelists was sent to you after you registered and is also available on the Mental Health Breakfast website. So I would invite you to go there and read the biographies of our distinguished panelists, and I spent last night reading them, and it's an incredible group of people we're going to hear from today. The format, as those of you who are familiar know, is that we'll have subject matter and lived experience expert presentations here, followed by the Q&A session, which will include 4 members of the General Assembly. And then our friend Rose Hoban will moderate the Q&A for each of these panel discussions. So anyway, I want to now welcome our experts on transitional housing, if they'll come up here to the podium. First, let me say, let's welcome all of them, and I'm going to just introduce them by name. Lisa Worth with ESG Homeless Programs Coordinator. Marty Nisley, Independent Reviewer of the Olmsted Settlement Agreement. They're in seat 2. Jacob Schoenberg is sitting in the middle, trainer with the UNC Institute for Better Practices. They'll be coming here and sharing some thoughts with you. And then the members of the General Assembly who will participate in our Q&A, Representative Marcia Morey. Let me see who's next down there. Representative Grant Campbell, Senator Sidney Batch, and Senator Steve Jarvis. Let's welcome all 7 of our guests. And Ms. Worth, I'd like to invite you to come up and kick it off for us. Welcome.
Good morning, and thank you for the opportunity to speak to you today. I'm going to deviate a little bit off of the transitional housing focus specifically and talk to you a little bit more broadly about housing and homelessness and how we as a state can make progress towards ensuring all citizens have a safe, decent, affordable place to call home. There are barriers. Some of those are access, just knowing about how to access those services, so increasing that awareness, the scarcity of funding, limitations on the existing funding, and of course, the lack of affordable housing in general. I don't imagine that these challenges are a surprise to any of you who have worked in or been around the housing services field. Access is where it all starts. For anyone seeking housing services, just getting to the right person or the right agency can be so confusing or unknown, they give up before they've even gotten started. I work in this system every day, and when a close family member of mine became homeless in North Carolina a few years ago, I had difficulty getting them connected to shelter and other housing resources. There are coordinated entry points in every county throughout the state. I know that as someone who works in this field every day. But making those access points known, readily available, and easy to navigate in the mainstream is a key first step. Next, if you do successfully navigate the system, the current situation in our state is that there are waiting lists for housing and homeless services so long that many of them are closed. You can't even get on them. And for the lists that are open, communities are forced to prioritize who needs housing the most. Is it the most vulnerable? Or said in a more direct way, the person most likely to die on the streets that night? Is it families versus adult-only households? Is it the elderly or older citizens versus younger households? Is it those with chronic health conditions versus those who don't have any medical diagnoses? Is it those who've been homeless the longest versus those who are newly experiencing homelessness? What choices to have to make every day? What about those with mental health or substance use disorders? Where do they fit into this prioritization? Who's putting them at the top of the list? With the exception of a couple programs, like the targeting program, Money Follows the Person, and Transitions to Community Living, housing services that focus on this population are limited. Many even deem those with mental health or substance use diagnoses as less worthy of housing due to those particular medical conditions. Less worthy of housing. Let that sink in. How many of you know someone who is successfully housed who has an active mental health or substance use diagnosis? I bet it's a lot if you really think about it. I grew up with one. My dad was a high-level executive at a national insurance company for decades, and he owned his own house. No one thought he wasn't worthy of that job or that housing because he drank a fifth of vodka every day. In fact, his drinking was almost celebrated and certainly expected. It was the normal course of business to do deals on the golf course or in the clubhouse over drinks. Those calling me and emailing me daily, asking for resources for housing, are not so different from him. It's only their circumstances that make them different and therefore deemed less worthy. We all know there's not enough affordable housing. However, we have learned a lot in the past few years about affordable housing and homelessness in our country and in our state. Specifically, the pandemic taught us a lot and put an emphasis on things we already knew. We knew there wasn't enough affordable housing. We learned during the eviction moratorium that in order to house someone who is homeless, often another household has to become homeless. Affordable housing units weren't available unless someone who was already housed in one of those units got evicted, which then made that unit available for the next household. We also knew there wasn't enough funding for housing and homeless services and rental assistance programs. We learned that throwing money at it isn't a solution in and of itself. As service providers and funders, we had more money than we had ever experienced in my 20 years of doing this work. Yet homelessness increased during and after the pandemic for the first time in over a decade. North Carolina experienced a 19% increase in homelessness from 2023 to 2024. 11,626 households were experiencing homelessness on any given night in North Carolina in 2024. Of those, 1,777 reported being diagnosed with a mental illness, and 930 reported having a substance use disorder. reported being the key word. We know those numbers are higher. We know we must have the infrastructure, the actual housing, to be able to put those funds to use. And we must be able to use those funds in a meaningful way. Of course, there's a need for regulation, oversight, guidelines. Part of my job is to uphold and enforce federal regulations for homeless services funds. However, what we need are regulations and guidelines to be structured in such a way to allow for funds to be utilized for a multitude of needs. So flexible funding is a key piece as well. Having a variety of funding sources that complement each other in meeting the vast needs of helping a household obtain and maintain their housing is also critical. If there's a longer list of what we can't do with the funds than what we can do, then successful housing just became a lot less likely. If we can't meet the needs of our households due to the restrictions on the funding, we are going to see the cycle of homelessness continue. When I talk about flexible funding, I'm talking about funding that can not only provide the basic types of financial assistance, but also provides basic necessities, such as furniture, food, cleaning supplies, other household supplies. Who wants to live in an empty home or come home to a place but you can't eat? Funding that allows us to connect households to jobs, health care, mental health care, and substance use treatment, if desired, is also critical to a household's ability to sustain their housing. We use the term wraparound services a lot, and what that means for every household is different. Simply stated, we need to be able to set them up for success by providing all the resources and tools each household needs to thrive. We need the ability to be creative and flexible with what assistance is provided and how that assistance is provided. We need to meet them where they are. So let's bring it all back around. Where do we start? Because we can do this, and we will do this. First, we increase awareness around how to access services and assistance and further streamline that process. Second, we increase the funding flexibility and the variety of funding sources so we can align the funding and the availability of services to the needs of those we are serving. Finally, and most importantly, the need to increase the affordable housing supply nationally and in North Carolina is the primary component to addressing homelessness and housing. It cannot be stressed enough that the need to increase the affordable housing supply is key. Thank you.
Thank you, Ms. Worth. Ms. Nisley, I'd like to invite you up now.
Thank you, Senator.
Thank you. Great to see you.
Well, first, congratulations to the awardees. I actually live in Cody's neighborhood, and I want to tell you that he also has a beautiful dog. So I have not often chased him down the street to ask him some things, but it has happened occasionally. So, and I don't have any hair jokes at all. So I think maybe you could find something new. So I'm here today to talk not about transitional housing, but rather to talk about supportive housing. And because of my role in the state, I'm going to talk about the cost benefits of supportive housing based on what we know, not only here in North Carolina, but around the country. And the reason for switching over to supportive housing from transitional housing, there's really two reasons. One is our experience all over the country, and in the decades that I've worked doing this, we never really accomplished transition to what? It became a group living situation where folks didn't have choice of who they lived with or what they did during the day. And for those of you who worked in transition programs, I know we're trying very hard, but it has been quite a challenge. And the second issue is that over the years, it began to cost more and more for fewer people. So, in other words, the programs couldn't grow because we didn't have the funds. And we've talked about the accomplishments today. In 2020, North Carolina ranked very low, kind of at the bottom of the barrel, on services for adults with mental illness in this country. 1/3 of the national average, of the average, 1/3 of the national average for services for people in the community based on population. And so I'd love to say the new funds last year, they made a dent, but I think we would all agree we need to keep going. So I want to talk about the building blocks of supportive housing. There's really two building blocks. One is the access to affordable, safe, affordable housing. You've just, we didn't even talk, and we're going to talk about the same things. And there are ways to do that that can actually reduce the overall cost and provide access to safe, affordable housing when paying no more than 30% of your rent. That's possible. That's possible. But just as in the service system we need to work together, we need to see the same work together over in the housing system with developers and owners, folks who make decisions on local funding, federal funding, and state funding to make that possible. Then the other building block are those support services that really work to help, and Lisa just did it, so I'm not going to go back through all of the services and supports, but we know what they are. We have evidence for tenancy support, which, by the way, crosses all of the disability groups that we're talking about today. We can go to the next slide. I've listed them all up here in the middle in the second bullet. We're talking about individuals who have been released from jails and prisons, people who are chronically homeless on our streets, and yes, youth aging out of foster care and the juvenile justice system. And also people living in institutions or being diverted from institutions, not only in our state, but all across the country. And just a figure that maybe even Senator Batch knows, 77% of the people who I have reported on, and I know I'm not supposed to talk about North Carolina today, but 77% of the people that we see in the settlement agreement have had trauma in their life. So we have a lot to work on there. So those are the building blocks. But what I really want to talk to you today about is the potential for the cost benefit and the outcomes that we see with supportive housing. So let's go to the next slide. The next slide, I'm going to give you some news from several studies. And by the way, I could talk about at least 10, 15 studies, all of whom have the same level and type of outcome. I picked Denver, Albuquerque, and the 30 parishes in southern Louisiana, which looks a lot like western North Carolina, minus the mud, okay? But they have a lot of water, okay? So they had a bit of a challenge, and I'll talk about lessons learned. But each of these studies had a what was the cost for serving people before they got into supportive housing, and what was the cost after they got? These aren't all cost and services, by the way. They're the cost to our communities, they're cost to the people we serve. And I'm not going to read all of the types of costs we're looking at. You can see those up on the screen. In Albuquerque, for example, they even looked at transport to jail, and of course ER on all of them, and shelter days, et cetera. So you see here the savings over a 2-year period after someone moved into supportive housing. Over $4,700 per person for the 500 people in Denver. And out in Albuquerque, you see all these percentages. The one that just strikes me more than any other is a 96% reduction in jail costs for the people in the system. 96% jail costs. And other, like 7% in transport costs, or 44% in substance abuse treatment costs. Think about reinvesting that money back into the system. That's the next $985,000 or million that we, more that we can put into the system. So there are ways to to very carefully transform the system and get these services back in. I want to talk for just a minute about Southern Louisiana. They lost all their housing for people with disabilities, and they didn't have that great a system ahead of time. They would say that. So they went about creating new services that could be Medicaid funded across all of those populations that you saw me list up there. They never separated them out. They had one rental system for all of those populations, so you didn't have silos. Didn't have silos. And some of the amazing information that came out of their study, because they wanted to look at Medicaid, because they created this new support system that was largely Medicaid funded. With housing first, assertive community treatment teams, which some of you are familiar with, including a forensic assertive community treatment team, well coached over 4 years, saw a 77% reduction in the costs for those individuals in 2 years. And they've kept going. As a matter of fact, after 4 years, 94% of the folks who were in that study retained their housing, which is maybe the highest percentage that we've seen anywhere in the United States. So I'll wrap this up by basically saying on the next slide, yes, we have challenges. I won't go back into the affordable housing. We've heard this morning. We know what it takes for a person with a disability, with mental illness to live in our community. Only paying 30% of their rent, there is nowhere except a couple of counties in North Carolina where they wouldn't have to pay their entire SSI check. So we know that we have the challenges on housing. And we know what housing works and how to get it. We may have a few challenges coming up with some of the federal housing programs, but we can do a lot here in North Carolina. And last but not least, what works? A commitment to giving people full tenancy rights and making sure that their rights are protected, both trying to get into housing, expunging records, doing everything we can to help people, and then having individualized supports. While the rental system may be the same, having a tenancy support system is also the same for everyone moving in, and then all of the supports that go with that. Access to in-home health care, medical care is so essential for our population as well. So this, I hope, gives us something to chew on here with respect to, if you get these savings, then what can we do next? That's the big question I leave you with today.
Thank you. That is plenty to chew on. And Mr. Schoenberg, please come up. Welcome.
Good morning, Senator. Thank you. Good morning. As you just heard, my name's Jacob Schoenberg. I'm your first lived experience speaker. I was born here in North Carolina. I grew up 20 minutes down the road, and I've never lived further away than Greensboro. My childhood home was loving and supportive, and I had the privilege to go to good schools, play sports, and generally live a healthy and normal life. That life began to change when I was a teenager. My mental health declined, my substance use increased, and I was unable to complete my freshman year of college. After my first mental health hospitalization, I was diagnosed with a serious mental illness, lost both my jobs, and moved back home. The word psychosis got introduced to my vocabulary, and my daily medication increased. Soon after, I filed for disability. Things didn't go well from there. Suffering from severe depression, mania, suicidal thoughts, and hearing voices, I went through numerous hospitalizations, heavy medication, and ECT. My family provided much of the same support an ACT team would have, and I would not have survived without them. This continued until 2007, when my outpatient psychiatrist convinced me to check into a treatment program. My previous attempts at recovery had not been successful. This one has lasted since June of that year. I became involved in mental health and substance use work a year later. 2 years after that, I found out about peer support, and I got involved in working on ACT teams for the next 14 years in that role. I now work as part of a training and technical assistance center supporting peer specialists who work in community mental health settings. I've stayed clean, rebuilt positive relationships with my family, survived cancer, and built a life as a happily married homeowner. I went back to school, and while it's been slow progress, I am now halfway through an MSW at UNC. I still take medication, and I still experience symptoms sometimes, but my only hospitalizations now are medical. As my friend Tom would say, I am truly living the dream. While with the ACT teams, most of my clients received SSI like I had. The highest amount I could have received when I started transitioning off of those benefits was $623 a month. The current maximum in 2025 is only $967 a month. This is an increase, but it's not much to live on. In my case, I was privileged to receive the ongoing support of my family, and that kept me off the street. This is a privilege that many disabled people do not have. That brings us to housing. Independent housing is good for people. It empowers people to take charge of their lives, motivates them to make changes, and with the right support, it can reduce crises and help people stay out of the hospital. As you've heard, it also saves the state money. But without help, healthy, satisfying, independent living is rarely possible on $967 a month. Returning to independent living was a huge part of my recovery, and as with so much of that recovery, I was only able to do it because I had help. There are many obstacles to disabled people renting homes. Fair market rent in North Carolina averages over $1,000 a month for a standard apartment. Most of these landlords want you to show income 3 times the rent, and they run credit checks and background checks that disproportionately affect low-income people. Even supported housing providers have barriers like mandated treatment and zero tolerance for substance use, including alcohol, something that the average tenant rarely has to deal with. These obstacles help to relegate the people I served to substandard apartments, rooming houses, and the street. Housing first, before addressing any other mental health challenges, is shown to be one of the most effective ways to begin helping people. In my work, we talk about the dignity of risk, the value in allowing people to take steps that we don't think they're ready for. I've experienced that value, and I've watched it be proven again and again in my work. Helping people take these risks improves their lives and, by extension, improves our communities. Major investments in mental health care and the creating of new housing programs driven by the Olmstead Settlement are huge developments, but we can do more. With funding for subsidies and supportive services, we can make sure everyone who struggles with their mental health has a foundation that allows them to focus on building their own recovery. We can give them the same opportunity to recover that I had. I hope everyone's enjoying the event today. Thanks for listening. Have a great day.
Jacob, thank you. You prove once again why the lived experiences that we often hear at our breakfast every year are some of the best parts of this program. So thank you very, very much. We're fortunate to have back with us again this year our friend Rose Hoban. Every year I get to plug North Carolina Health News because I don't know about y'all, but it's something I read every day, and if you don't, you should. It's bookmarked right there in my web browser. Rose and her team do an incredible job covering healthcare in North Carolina. I had a chance a few months ago to visit with Rose. It was raining in downtown Durham one night. She and her husband were stuck in a bar, and Sarah and I happened to be stuck there, so we just had a cocktail or two, and I got to hear a lot more about Rose's life before she was a journalist and her nursing career. So if you talk to Rose sometime, find out a little bit about her nursing life, because it really informs so much of the incredible work she's done since she left nursing and founded North Carolina Health News. And we are just so grateful to have her here facilitating our Q&A session once again. Please join me in welcoming Rose Hoban.
Thank you so much, Senator Woodard. So as usual, I'm going to stand out here and lob questions at our legislators. When you registered, you were asked to ask questions, and so we've taken some of them and I've added some others. So the first question I'm going to ask is kind of off topic, but not really, because we've talked about it, namely that, 2 years ago, less than 2 years ago, North Carolina expanded Medicaid after a decade of trying. And this has allowed, as mentioned earlier today, it's allowed the state to allocate more funding to things like mental health and substance use treatment. As Kelly Crosby noted this morning at the orange juice reception, that nearly half of folks who were on state dollars for substance use treatment are now on expanded Medicaid. So now the program's funding, it seems, might be at risk from Washington. We're hearing a lot of things about significant trims from the federal government. So what kinds of conversations are state lawmakers having with our congressional delegation about protecting Medicaid funding? Any? Maybe you should? Sorry.
So I think one of the challenges is trying to figure out what that cost share is, right? There are a lot of conversations discussing HAS being, eliminated altogether, which are direct hospital payments, where the hospitals in North Carolina are taking care of the 10% share, so it's not a tax burden on us, and the rest of it comes from the federal share. And so we as legislators, with a revenue forecast, frankly, that's going to be pretty bleak, I believe, coming out, have to make really hard decisions about what we're going to do. We hope that our delegation realizes and advocates for Medicaid expansion to continue to be funded at the levels that it is. But if that does not happen, we are really looking at 600,000 North Carolinians and the Medicaid expansion population actually losing that funding. And then on top of that, we already have $81 million in just the rebase of the Medicaid population that we didn't fund in our budget, right, our state budget. So if we want to continue to provide those services, we as state legislators need to take a really hard look at our budget and our priorities and figure out how to provide for that.
Anyone else? What are you hearing from the congressional delegation? Are there any conversations happening yet? I'm really curious.
From the congressional delegation members that talk to me, yes.
All right, okay, all right.
They are not the ones in charge. So I can tell you they're advocating. I cannot speak for the others with regards to our congressional delegation that actually has the ear to the president.
All right, terrific. Thank you. So as we've heard, and as Jacob so eloquently noted, and Marty, actually all of our speakers did, noted that we have a huge need for housing for people with mental health issues. At the same time, as we have a profound lack of affordable housing options for everyone in the state, what is the legislature interested in and willing to do to address this widespread need, particularly for some of our most vulnerable?
Well, I would just say that I know that in the Senate, the General Assembly, we actually created a new committee, which is the Regulatory Reform, Regulation Committee. And we're looking at many different things when it is regarding housing that cause problems, whether it be from the local municipalities, from cities, density requirements, and whenever we get in and talk about mental health and the need of the treatments and the housing for mental health, then the stigma from people just literally saying, not in my backyard. And so we're trying to work through those situations. I know that our first speaker mentioned regulations that need to be expanded. I would love to talk with her on that and try to see what we can do to try to work with the funding that is available to be able to make things work in a facet that it should. One other thing that I think is necessary and we have worked on, so from Davidson County, where I represent Davidson and Davie, I actually brought some funding back to actually build a new homeless shelter, which is going to be a one-shop all the way across the board. You've got families, you've got individual homeless, you've got substance abuse, you've got counselors, you've got all of the treatment needs, social workers, all within one building. No, it's not built yet, but we are getting started.
Representative Campbell. Nice to meet you, by the way.
Nice to meet you. I'd kind of like to give this kind of a little narrowed perspective from the medical perspective. I've been a practicing physician for over 25 years, and I want to give an image that is not going to be a surprise to anyone in this room, but it needs to be spoken about outside of this room, and I think the onus is on us to do that. When I started in private practice, I've been an OB-GYN for 27 years and a trauma surgeon for 9, but when I was called down to the emergency department for a consult, I'll take you back to the early 2000s when I started this. Maybe once every 6 months, you would see a patient in the emergency department that was a hold, that their acute treatment had been taken care of, but they were held at the emergency room for requiring inpatient behavioral health, that they had housing insecurity or things like that. And this was a rare occurrence. I would say on average now, if I go to the emergency department, I'm still practicing when I'm not playing a politician, it is not uncommon for 25% to a third of the emergency department to be occupied with holds of that same nature. Okay, and this is a multifaceted problem. Okay, the folks that are there are not getting what they need. There are safety issues for them. There are safety issues for the staff. And then also that is a bed that's not available for someone that comes in for care after they are. Now, this is a multifaceted problem, and if you're looking for that bill that's going to fix it all, that does not exist. We start chipping away at the edges until the total product starts to get better. But I think one of the things that we need to pay a lot more attention to is smaller organizations that are doing this well. Sit down, and talking about us, what we need to get off our tuchus and do is say what works for you and what are the impediments to scaling this up. What are we doing to get in your way? What do you need from us? But there's got to be one more step that I think as political figures we're maybe not very good at, and that's looking back once you do something. I tell people, politicians, we love a ribbon cutting more than Peter loved the Lord. We love it, okay? Cameras are there, we can smile and show it off to everybody, and we'll overstate what we did to make that happen. But look, I've had 2 jobs in my life. I've been a physician and a soldier. I care about results, and I tell people we need to do a better job of carrying what's behind that ribbon, okay? Is it designed for what we're supposed to do? Is it going to do that? And most importantly, and we need to do a better job of this, but I need everyone to be receptive to this idea, is after we cut that ribbon or we pass that law, we need to look back over a period of time and say, did that accomplish what we thought it would? Is this solving the problem that we told everybody at that ribbon cutting that it would? And we all, everyone in this room, myself included, we have to be honest about it. And we need to go away from, if we do something that's not working correctly, we need to stop the punishment and we need to start the pivot. Okay? Didn't work, or it didn't work exactly how we did. Okay, how do we fix the parts that didn't work? And I know getting a politician to admit that they were wrong is quite an undertaking, but I think that we've got to do a better job of that kind of after-action review. Thank you.
Thank you for that. I'm going to use that line sometime. Representative Morey, you look like you wanted to say something.
Thanks, and I guess if we go back to our history, I go back 26 years when I first started in elected office as a judge. And every day I would go to our courtroom and I'd go to that juvenile courtroom. And watching the kids, many who had severe behavioral mental illness, not because they asked for it, because they were children. Many were victims of abuse, neglect, and we needed facilities, we needed treatment. And even though Durham had probably one of the best systems of care, we couldn't find placements unless it was locked up in our detention center. And I remember getting a call one night, do you know that this 15-year-old tried to commit suicide last night? I said, he should have been put in the group home in Virginia. They promised he had a placement on Friday. It fell apart. And he almost lost his life because we couldn't get him the placement we were promised, and I signed the order it would happen. But what we need to do, we need to make it a priority to help the kids, help the criminally justice involved, adults, the youth. We have taken away their freedom because oftentimes of a mental illness. And it's incumbent upon us to give them the services, the care, the help, because they are coming home and they need to be near their home and work with the family. But we are still, 26 years later, I talked to someone today from DHHS, 60% of our youth are being sent out of state instead of treating them here near their homes with their families. They will not succeed in that scenario. So, priority, we are paying for opportunity scholarships for people of any income to give them tuition. I know this gets political, but it is, where is the priority for our dollars? And you look at that and you look at the needs we have here. I have no power, I'm in the minority, but I do have a voice, and we need to bring these things and say, what are our priorities? And I think the behavioral health of our adults coming out of the criminal justice system and our youth have to be put at the top. Thank you.
You know, the question is always about dollars, and you talk about being around for 26 years. I've been around, hanging around the North Carolina General Assembly for 5 years, longer than I care to think about. And I remember, and I've seen this happen multiple times, that we come up with a program, such as closing Dick's, and we say we're going to save X amount of dollars, and then we can reinvest them. But Marty is starting to smile here, but they don't get those dollars don't get reinvested back into the mental health system. You know, what is it time to take another look at savings accrued and be more conscious about cost-benefit analyses to take dollars that are saved in one place in the system and reinvest them in the communities, into community services? And why doesn't that happen more regularly? Anyone? And that was actually a question that was here. That wasn't just me.
I'll take this as the new guy, and I'll say that savings and revenue becomes territorial in politics, and I think that we like to brag on the front end of the money it's going to save, but when it saves it, we don't want to give it up somewhere else. And so I'd say that if we're saying that if this is going to give a relief to a certain population by doing this policy, unless we can guarantee that that population is no longer in need, why don't we take that savings and find ways to effectively do it that way? Now, there's a broader problem in this as well. Polarity, political infighting. I'll tell you a funny but yet embarrassing story. I think one of the first quotes that got recorded of me as a candidate, I just got elected, guys. I've been in the State House about 8 minutes, but we had our first candidate forum, and after it was over, someone said, what was it like observing, people talking about their different political views? And probably should have phrased this differently, but I kind of said it seems like zoo animals throwing their own poo at each other. And it kind of is. And look, I will say, for all of you giggling and nodding, I challenge everyone to self-reflect that we maybe all do it sometimes. But I think we need more of what we see right here. We're from all different parties. We're from all different backgrounds. We're here not because of the breakfast, it was great, by the way, but we're here because we care about this, and I think we set the example for more bipartisanship going forward.
Okay, so a question from the group. Is there energy in the legislature for, funding development of alternative housing models for more clinically challenged patients? So Marty talked about the fact that, independence, and also our other speaker, and brain fart, having a little bit of a moment, that these are, it's really important to have alternative housing models so that folks have some place to go. What kinds of willingness to fund some of these models is at the legislature? Things like, smaller group homes or supported housing complexes like we have up here in Carborough at Club Nova, more transitional housing. What kind of appetite is there?
I mean, I've had conversations and, with Kelly Cosby, who's absolutely amazing with regards to the behavioral health space and kids and transitioning youth, like we talked about with regards to foster care. But I think the bigger issue is going to be the fact that there are individuals, most who were incarcerated and justice involved, who have criminal backgrounds. And the laws that we have in place prevent them from actually getting any type of housing that is actually meaningful and is going to be even affordable or safe, right? So not all housing we know is created equally. And we also know that a lot of individuals can't actually get that housing because they've been justice involved, oftentimes because they had substance abuse problems, oftentimes because they actually had traumas that were untreated, and that's what they used substances in the first place in order to go ahead and treat the issues. And so, while this will be a political statement, I still stand by it because I think that we actually have an inflection point in our country to decide that if we actually have a president who is a convicted felon living in the White House on government dollars with a government job, eating government food, and living in government housing, I'm pretty sure we should actually start looking at this state, to the extent that we can't control the federal, what we're doing with regards to the waivers that we can have with other individuals who may have been justice involved, who should not be judged by the worst day in their lives if they are doing the work in order to become better. I'll probably be fact-checked on that, and you will never see any of my bills. Congratulations, you guys.
That wasn't political at all. I don't know. Anyone else want to? I mean, sort of going back to, back to trying to, alternative forms of housing for folks aside from the criminally justice involved.
I will also say on a serious, well, that was actually a very serious note. On a second serious note, we are talking in smaller communities about taking places, no offense if you sleep at a Motel 6, but taking Motel 6 that may not actually be in a position in which they, are at a high occupancy, and rehabbing those for actual individual units that can be used in our communities to assist with transitional housing. I think we need to look at the state level of doing a public-private partnership and looking at tax incentives of those property owners so that we can go ahead and give them the upfront fees to go ahead and change those into studio apartments that are actually affordable in the backyards of many of the communities and families that they need their support, so that they can go ahead, become stable, get the services, get the help, get a stable job, and hopefully transition into more appropriate and stable and permanent transitional housing. Y'all, there was a study recently that just came out. The average age of the homeowner back in the day, 31. It's now 39, right? So everyone in this room, right, we're doing a lot better than the individuals that we're trying to help. And so I think we have to look at a holistic approach of trying to figure out how we're going to address that. And that is actually happening in some of the places in North Carolina. I would love to see a statewide approach to that.
So, we've heard a lot about the historic investment of $835 million made in the last budget in mental health services. There are some who would argue that this is simply making up for underinvestment from the past decade. So Marty actually stole one of my stats here. If you go back and look at the number of adults who we're serving, it's about we're serving about a third of the average per capita folks with mental illness who need services. Meanwhile, the cost benefit's clear. Even if you're living in supportive housing, it's cheaper to be in a setting like this than in the community than an emergency department, prison, psychiatric facility. So why is it taking North Carolina to get so long with the program? And when are lawmakers going to be ready to embrace the change? That was the question. I'm sorry? So why is it taking North Carolina so long to get with the program on saving this kind of money, right, by not having folks in EDs and psychiatric hospitals and, prison? Why is it taking the state so long to get with the program of getting people into transitional housing and getting people services? And when will lawmakers be ready to make this number, make this statistic change?
Well, this may be one aspect of it, because I can't really answer the policy part. I just got here, but I can say some of this is it's become impossible to ignore. And I'm telling you that as a private citizen and as a practicing physician, is that, seeing the emergency rooms clogged up and seeing tangible examples of this going on and the shortages that they provide, I think that the noticing of it has become more prevalent. I think the speaking about it has become louder, and that's a good thing. I'm not saying that's a bad thing. Is that one of the reasons it's taken so long? Quite possibly. I think that we do need to take more calculating views of return on investment. I agree with you. I think that if you look at adequate mental health care, the return on the investment of those dollars is very positive. So I'll punk out a little bit, say I hadn't been there until now, but I do say, I will say it seems as a private citizen, especially someone in the healthcare system, that it's just impossible to ignore anymore.
So in other words, you can leverage the public discomfort that people are having right now into maybe making it into policy.
Well, I guess partly in a way, but I think one of the positive things from that is that maybe more phone calls are happening in Raleigh of constituents that are saying, hey, I waited 8 hours for my broken leg, and I noticed when I got back there that the ER is almost halfway full with people that have already had treatment, but they're waiting to go somewhere else. And I think that those things matter, and I think that with that noticing happening more, maybe that's getting more attention.
I guess one of the messages is to people in the room to make sure that they're calling their lawmakers. That's not advocacy, by the way, not by me. But just saying, it can help.
I think there's one other thing that we need to remember. There's been a push to do away with group homes and places that have already an operation that are able to take care of a lot of our juveniles. And I think we need to get away from a stigma that group homes are a bad thing. They are one of the pieces of transitional housing. They're much better than being put in the ED.
And that actually kind of goes into the next question that I had here that came from the audience, which is, what has the legislature done to improve permanency housing for young people in foster care or kids who are at risk in North Carolina? And what might you be planning on doing?
Well, I know last session, since I came in 2018, I introduced a bill that was to introduce permanency for substance abused children and to expedite permanency to within 1 year once the determination has been made that it's to be removed from the home. I have fought with that bill. We worked on it again. I worked with Senator Batch. We worked on it together last year, got it in a good place, and we passed it, but it was not able to get across the finish line. I plan to bring that back up. One thing that I'm very passionate about is foster care. During my life growing up, my mother fostered 18 children. During that time, I have lived with foster children. I know what it's like. And whenever we look at substance abuse, we're looking at the after effect. We've got to get back to the root cause and try to take care of the root cause of the problem. And I think this bill would help accommodate that.
What, does the bill have a number yet?
No.
Old one was 625.
But 625 was great.
Oh, yes, I remember that bill.
So what I would say is, in this space, foster care is actually, it's very important for both Republicans and Democrats. It is not a partisan issue. It's not a political issue. We may disagree on the outcomes and whether or not permanency should be a year, or you truncate the time in which a substance use, tax positive child is born, and therefore you need to expedite permanency for that child. What I will tell you is that Representative Reeder and I have had great conversations with regards to the youth that are sitting in our EDs and all of the behavioral health issues. I've had great conversations with Representative Chesser with regards to, and Representative Loftus. I mean, Senator Jarvison and I have been champions in that. I've already started talking to Representative Campbell about issues regarding the mental health space, and obviously the, postpartum issues with regards to women. Whether or not in the maternal health space, you know what? When you actually have an entire industry that was preying on people for a really long time, and then you go ahead and you have opioids and people are addicted, you got to find better outcomes. And there are women who are going to go through a lot of substance use treatment where it is stigmatized in the maternal health space, which, by the way, North Carolina has some of the most abysmal maternal health outcomes, mortality, especially infant mortality as well. So I do think that moving forward, I have had a lot of conversations with my Republican colleagues, again, not in power, so I can't move a bill, but I do know that they have the willingness and the ability and the passion to go ahead and move some version of 625 so that we can address both the kids that are in the EDs, but permanency in general, because we have way too many children, as we have already heard, being moved out of state for mental health challenges, and frankly, a foster care system with 1,000 less foster parents that have actually registered because of some of the challenges. So I do have a lot of hope in all the craziness that's going on in the child welfare space, that we in a bipartisan fashion will actually move a bill that's very similar to 625.
I will say, look, I'm a data guy, but, and you touched on this a little bit earlier, is that I think let's not ignore one of the best pathways to permanent housing for kids is reunification when that is possible. And I'm going to make a couple of points about that, and everyone that knows me will agree I am a nerd about data. But you talked about the resources for placement of kids having to go out of state. And if you look at the data, if you take the distance that the child is located away from the family, the higher it goes, the lower the chance of reunification that happens. And so if we can expand those resources locally, I think that will help a good bit. I think we also need to look at these kind of arbitrary cutoff times where, if there's a family that's having struggles and part of this resulted in the kid being removed from the home, there's not a magic number that you can say with full confidence to say if you haven't fixed it by this date, you can never get there. And I think those are arbitrary and those sound good. And that's part of the thing. Sometimes things can make so much sense in Raleigh, but you guys are going to know I'm going to bug the hell out of y'all because I'm going to call you sometimes and say, this makes perfect sense. Please tell me how it doesn't. So I want reunification to be a bigger part of that kind of permanent solution.
Thank you, Representative Maury.
I'm just going to bring it one more time back to the criminal justice system. We have tens of thousands of people who have been incarcerated that come out every year, and they need places, and they need transitions. And yet, if they go for clemency, if they go for parole, and they don't have a reentry plan, or they're not in one of the 17 counties that have great reentry councils that try to help these people, they can still be held incarcerated simply because they don't have a transitional plan, a plan to come home. And I applaud the General Assembly, the Republicans in the majority of the budget, the JPS system to help bolster the reentry councils, help these people when they come back. They won't recidivate. It is public safety, and it is humane after we've held some of the kids that were convicted when they were minors. We have in North Carolina a 13-year-old, when the crime was committed, who has been in over 50 years in prison and is not being released because there is no good reentry plan. With 2 infractions in the last 20 years, because we don't have a transitional housing, that individual is staying in prison. That's not right. And we have to make it a priority for the people who are not seen and not heard, but you all are the advocates.
And we have our advocate, and I'm going to give Marty Nisley the last word.
I'd just like to say this panel has introduced a lot of issues, and I'm sitting here going, I know what they could do, I know what they could do, I know what they could do, I know what they could do. But because I am involved in a federal civil rights matter, I want to stay away from that a bit. But I happen to know a few things, and one of those is that because of the increase of tax credits during COVID, okay, it's going to get a little wonky here for a second. That meant that there was more affordable housing being built in North Carolina in the tax credit program than ever before. And from last January through January 2026, there will be over 2,665 new units for people with disabilities, including people coming out of, could be, I won't say could be, coming out of our justice system, youth aging out, and all of our disability groups. And your Housing Finance Agency has done a great job of making sure that 10%, that 2,665 is 10% of the total. So we're talking about 26,000 new units, 6,065. There has been a rental allotment for use in what they call the targeted units. It's called the KEY program.
Right. Mm-hmm.
The KEY program. It has not kept up with funding recently for the need for people with disabilities, all the folks we're talking about today, to be able to actually use one of those units. Okay? The only money going in for rental for those units right now comes out of the settlement agreement because you have to keep pace to make your numbers. But they're not going to fill all 2,665. What if there are more units in Mecklenburg than they can ever fill? They could be filled by other people if KEY was available for them to fill those units. That's something we can do tomorrow. And since we know the value, even with funding that rental assistance, is going to be tough, we know the value of what you will gain offsets the cost for that rental assistance. And by the way, once you put it in, it's permanent housing with supports, that wraparound that we've been talking about, making sure that people get what they need where they are. And I'll stop here, Rose, because she's looking at me. Thank you very much, Marty. I just happen to know so much about what I think you could do that I'm just excited that you're talking about it. So
I think you need to spend a little time at the legislative building. So, all right, well, thank you.
I would like to make one statement. I always feel like reunification is the best choice. However, it's not reunification at any cost. We need to put what is best interest of the children. So many of our foster care children are in and out of homes, over 10, 12 different placements. Whatever is best for the children. We've got to put the children first. Thank you.
And thank you very much to all of you. I'll let you go. Now you can get off the hot seat.
Thank you to our first panel. Let me invite the participants for panel number 2, if they'll make their way up to the stage. Okay, let me introduce our panelists for our second panel on substance use programs. Starting to my immediate left, Dr. Amy Blank Wilson is Associate Professor at the UNC School of Social Work and co-director of the Tiny Homes Village. To her left, Mona Towns, Mobile Crisis Unit Director at Integrated Family Services. And Mike Roberts, Director of Outreach for Addiction Professionals of North Carolina. Our legislators, Senator Jim Bergen, Senator Gail Adcock, Representative Renee Price, and Representative Tim Reeder, MD. So I would like to invite Ms. Towns, if you would come first. Well, you're welcome.
Thank you. So I think it's officially good afternoon now. So good afternoon. Let me be the first to tell you good afternoon. Thank you so much for inviting me to the legislative breakfast. I must say this is my first one, but it will not be my last. Thank you. Again, it's an honor to be here today, to be in the room with so many individuals with a common interest, substance use and mental health. Thank you in advance for all you are doing to take care of one of our most vulnerable populations in our state. I want to start first by sharing just a personal story that resonates still with substance use services, and many of you probably in the room. A couple of years ago, my uncle was struggling with substance addiction. And after many conversations, one day he called me and said, "Nisi, I'm ready." That was transformative. If you are a family member or a loved one of someone who struggles with addiction, you could understand the impact that had on me at that very moment. I was fortunate to be able to contact his local mobile crisis management team, who responded really quickly, was able to connect with him. He didn't have to wait 3, 4, 5 days. They were able to connect with him and get him connected to a facility-based crisis center in his community. From that facility-based crisis center, he was connected with a long-term treatment program. But as so many who were in recovery during COVID-19, he also experienced a relapse. But it was crisis services that once again stepped in when he was ready, stepped in and assisted him with getting reconnected. He has remained in recovery, graduated from the program, obtained his CDLs, which if you know anyone who has been through that process, that is a pretty heavy process. But again, I'm so honored to be his niece and so honored to have been able to help him get connected with resources in the community to hopefully this time sustain his recovery. At Integrated Family Services, we currently provide mobile crisis management services in 33 counties in eastern North Carolina. That's a lot of work. That's a lot of work. But we are honored and we are proud to be a part of the system that is helping, in many ways that do not go recognized. I really want to make sure that as we have been having conversations and we have seen the fireside chats and we have heard some different conversations about strengthening the crisis system, I personally want to pause and thank our elected officials, thank Secretary Kinsley, who I think has snuck out, thank Director Kelly Crosby, and we look forward to working with Secretary Sambai over the next couple of years. When I think about my uncle, I also hope that you will take a moment to think about possibly your uncle, your sibling, your parent, your child, and what it is we can do to make sure that they have the care they need when they need it. However, we know that a strong crisis system depends upon a strong workforce. We have already heard it, and yes, as a provider, providing the services, I'm here to say we are feeling it. North Carolina, I am a social worker. North Carolina, we have over 18,000 licensed clinical social workers, yet too few of them, except for me and a couple of my colleagues over here, want to work in crisis services or even community-based services. We must prioritize workforce investments that have already been shared this morning and even this not too long ago. We must prioritize those investments in community-based mental health treatment services through making these careers more appealing. Yes, we have heard social workers leave and go to the private sector. There's a lot of work to be done in community-based mental health services. Just some of my thoughts: increasing competitive wages, making it where that those who remain, I've been in community-based mental health for almost 17 years, we want wages that we can afford and make it appealing to stay in community-based services. We need loan forgiveness programs that may not be public student loan forgiveness programs, but that we are eligible for, again, those of us working in the private sector, and increasing professional development opportunities for us. Those of us who are licensed can understand the cost of obtaining those CEUs every other year. Beyond our state, with Integrated Family Services, we've had the options of attending and partnering with other mobile crisis teams across the nation, where we have shared best practices, we've shared different ideas, we've come back with some different ideas, and we look forward to things such as different initiatives that the state will continue. One of those initiatives we recently worked with was the Carolina Across 100 initiative, where we were here, maybe some of you, last year in this same auditorium auditorium where 15 teams across the state shared a common goal: suicide prevention in all 100 counties across North Carolina. This was an opportunity for us to connect because many of you know sometimes we work in silos, but we were able to partner, connect with other agencies where we were able to obtain different resources that we took back into our communities. The impact of crisis services goes beyond the individual. It impacts families, reduces the strain on emergency departments and law enforcement, and builds stronger, more resilient communities. By focusing on fostering collaboration, more conversations can continue to be had, and we will continue transforming how individuals experience and recover from crisis. Thank you for your commitment and support for mental health and substance use services. Together, we can make a difference, one life at a time.
Thank you. Dr. Blank Wilson, if you'll come up. Welcome.
Okay. Hi, everyone. Thank you for everybody for having me here. I'm very excited, and I'm going to try to keep this condensed. I have my notes. We can all hope. I want to say that what I'm going to present on here is related to research that I've done over about 10 years in one of those northern states that we won't mention. And it also stems from my work as a social work practitioner in therapeutic foster care, crisis mental health services, and actually as a probation and parole officer in one of those northern states. So what am I talking to you about today? Well, I'm going to talk to you about the experiences of people with mental health and substance use challenges in jails, all right? Nationally, about 10 million people are admitted to jails each year, most of whom will be released within 7 days or under, and the majority of whom will have a substance use problem. People with mental health and substance use challenges in jails face the worst outcomes across the board. In the data you see here, we're looking at, well, if I would turn the slide, we'd be looking at one of my first charts I ever made like this, just so you know. But when you look at that orange and green lines, those are the rates of return to jail within 4 years, for 1, 2, 3, 4, right? And so what's the takeaway from this? Well, first, I could do that. And second, most importantly, that we're looking at substance use as a driver. People with a substance use problem are returning to jail at the highest rates. And if you have a substance use and a mental health challenge, that's the worst situation, okay? So now, some of you might be wondering why I'm focusing my time on talking about the experience of people incarcerated in jail with a substance use and mental health challenge. And so I'm gonna make some kind of statements, so hopefully we can all come together on the same page. First of all, people with mental illness have disproportionately high rates of involvement in the criminal justice system across the board. And up to 90% of people with mental illness in the justice system have a co-occurring substance use disorder. So I think this is a really important thing. And once they're involved in the system, and once they're incarcerated in particularly, they are vulnerable to a lot of additional adverse events. So they're vulnerable to exacerbated mental health symptoms. They're vulnerable to victimization. They will almost surely face a severing of the ties with their, at least temporarily, with their community providers and their families. And they often face longer periods of incarceration. So for all of these reasons, we want to think about jail as like an early intervention place, right, for people with mental health and substance use challenges. Now, here's the other part of the story we're looking at. I'm going to explain this pie chart to you. What you're looking at here is we asked people with mental health and substance use challenges incarcerated in jail to prioritize what their service needs were at the point of release. And I'll talk to you a little bit about why I did that more in a minute. And what I want you to see is you see those two big things, the blue one and the orange one with that really small key that no one can read, right? That's housing and money, right? So, and the thing about jails that everybody has to keep in mind for where we're going is when jails, and this is not a competition between jails and prisons. I do a lot of work in prisons. They're really important too. Jails are a very unique institution in that, well, they're actually a lot like a psychiatric hospital in some ways, in that your time there is chaotic and your release is unpredictable, right? By design. And when you leave the doors of the jail, even short incarcerations can disrupt people's, particularly people with mental illnesses, access to all of their resources. And so they have to rebuild. And so they are forced, they're confronting this situation where they have to deal with competing complex needs at once. And so when we ask people, so you have all of these needs and they're all important, but how do you prioritize them? Housing and money, right? That's what people need. And so we took it a step further. In this study, I followed the reentry experiences of over 60 people with mental health challenges, all of whom had co-occurring substance use disorders, who were receiving support from excellent case managers, okay? So they were getting state-of-the-art support. And I really had come to question whether the way we were framing what people's needs were at the point of release from jail and prison matched, we as a system were framing it, matched people's experiences and how they understood things. And we mapped out the help-seeking pathways that people took from jail when they were released, with no preconceived notions about what that would be, centering it on their experiences. And I just want to say these things. A lot of people in the room are probably, this hopefully resonates with you. I was recently in Oklahoma, and they called this a Rosetta Stone of reentry planning. I said, wow, okay. I mean, this goes pretty far for people. And I just want to center us on this initial period after release. We know that this is a very dangerous time. The first 2 to 3 weeks after somebody is released from jail or prison, their risk of mortality is 20% higher than the general population. And substance and overdoses and suicides are two of the primary drivers of that mortality. It's a very dangerous time. It's a very fragile time. And what the research we did showed, it's a time where people are fighting for their very survival. You leave jail with what you entered jail with. And when you're a person with significant mental health challenges and a substance use disorder, you might have really just been holding it together when you went in, and now you have nothing. So you're fighting for weather appropriate clothes that fit. You're fighting for food to eat, meaning like you're struggling to figure it out. You're not literally hopefully fighting, right? You know, they're trying to make it work, right? This is a very short window of time, right? And then if you're lucky enough to get through that period and still be moving forward and you're not back in jail already, right? Or somewhere else, you know, then that's when people start to put things together and they're trying to get back on their feet. And that starts with finding a more suitable or permanent form of housing, getting their benefits turned back on. Only after all of those things are done do people focus on getting help. Only 40% of the people in our study even got to the front door of a substance use or mental health treatment provider. Because I'm going to say it this way on purpose, we failed them. We failed them in our ability to help provide what I think now we think of as social care that they need, that's an integral part of their return. So, I put this up here quickly. I see the red light is on. I'm keeping moving. And I hear all the great things here in this room today, which I think are so important, you know, in terms of thinking holistically, you know, finding comprehensive ways to work with people. I would add that we need to also be assessing and dealing with the impact of criminal justice system involvement. That is part of what we are treating in a population that has such wide contact, right? So if this is the model, we all know this is a goal. I've been doing this since the 1990s, right? You know, we all know that integrated care is actually really difficult, and then we start to add in social care. So I thought, well, I have this moment, I think maybe 1 minute left to tell you all a few things about solutions, right? This hasn't been fun so far, has it? Right? No. But the reality is we're at a really interesting point in time. We have waivers coming on board. We have bipartisan support. This is an issue that people really care about, right? What do we do to help people? And so I'm going to say a couple things, and I want you to really hear this first one. We have to increase the continuity of community in jail. We have to move the community into jail. right? Jail is traditionally thought of as being the separate place outside of the community, and it functions that way in many ways. We have to move the community into the jail, and we have to increase the continuity. And there's lots of ways we can do this. And I'm a national expert on a lot of things, and I'm here to tell you, you're going to get there through local solutions. I've never seen a single one thing work. I've seen a lot of different things work based on local context. And now I'm going to tell you about a program that you already have, that I have no investment in. I'm just the biggest fan. Does anybody know what I'm going to say? The FIT program. The FIT program is here, and they are doing it. They're doing integrated care that includes social care. They're doing all the things, and the Department of Health and Human Services is funding them to work in prisons. I say, let's bring them to jails. Let's bring them to jails, and I'll tell you why in a second. And when we do programs like FIT and other great local innovation that is happening here in North Carolina, we need to move the point of intervention to admission in jails. The average length of stay is 7 days or less. So we have to not be waiting for somebody to be sentenced. There's a lot of complicated reasons why that doesn't necessarily work, that model doesn't work in jails. We need to move it upstream, treat it like a hospital admission, and work towards the release planning from admission. And then obviously we're going to reintegrate care into treatment for people with mental health and substance use challenges. And then the last thing I'll just say is I think substance use services are a lot of things, and they face a lot of challenges and do amazing things with very limited funding. And they're very good at prevention and what I think of as postvention, right after a disease is identified. The jail really offers a unique middle ground in some ways, and I am no way, shape, or form arguing we should be incarcerating people with substance use problems. I think we should be decarcerating people with substance use problems. And when they are there, it is a unique opportunity to focus in this in-between space. Thank you.
Thank you, Dr. Blank Wilson. Mr. Roberts. Welcome. Thank you.
I haven't been in one of these for so long. Like, this is seriously like what I had to stay in often. I actually haven't been back since I was incarcerated. My first mugshot, I was smiling way too big to be going into jail, but like, that was a rite of passage, I withdrew from drugs probably 100 times. I went to treatment 26 times. So I always like to say my rock bottom had a basement, and then I dug a hole. I contacted a lot of different folks in recovery and was like, what are you guys doing to stay clean? And I got a lot of different perspectives. And I posted that on social media, and Sarah Gayton got wind of that. And she was like, let's make a poster campaign.
Jails tend to be very bleak, very dark. So Faces of Hope was started with the idea of wanting to put meaningful imagery into the jail.
APNC is the professional trade association for the substance use system across the state of North Carolina. We are the only trade association in the state that advocates for the full continuum of substance use services, from prevention, harm reduction, intervention, treatment, recovery support services.
I've had people at my treatment center be like, I went to jail and felt so down, and I looked up and there was your face, and I was just like, and they're like, it gave me hope.
We tried to make the resources as available to anyone. You can call this number at any time and they'll connect you to resources.
We wanted the legislature to know that hope exists and recovery happens. So we didn't just buy into the poster campaign. We hired an outreach director. We hired Mike Roberts.
Mike is awesome, man. He's my friend. I first met him in treatment, and he's somebody that I looked up to instantly.
I've been arrested 40 times, over 40 times in Buncombe County, and I've been to the state prison 5 times. I spiraled out of control, being pregnant, and eventually that caught up with me. My rock bottom was when my daughter was taken from my custody.
I remember sitting in holding and seeing the Faces of Recovery poster, and I couldn't help but smile seeing Mike. This overwhelming sense of everything's gonna be okay came over me.
Now I'm a bail bondsman. I work in the places that I spent quite a bit of time in, and honestly, I love it. The posters, when inmates come out that I work with, I'm able to be like, hey, check this out. You know anybody on there? You know what I mean? Take this, you know, you may need it. This may save your life.
The Faces of Hope program actually does what it says. It gives people hope. It tells people, hey, there is another side of life. And, you know, drugs and substances and alcohol, they are tremendous monkeys on people's back.
There's this red tape in the jail, and if you're an inmate, you're not allowed to cross that red line. And I remember the peer support was standing in front of that line, and I was standing on the other side, and I remember I was just staring at that red line, and I got enough courage to look up, and I said, I need help. I think the campaign with the Faces of Hope and Recovery is definitely impactful, because you get to see a real person who has been through something, and a lot of those people might even recognize us from the community, and you get to say, hey, I know that person, and if that person can do it, I can do it.
Oh, man, that guy, you know. I just want to take a moment to soak this up. I tell this joke often because I've hit different stages, and if you would have told that guy on my 26th trip into treatment, Mike, one day you would be addressing the 47th legislative breakfast, I would have asked you for the drugs that you were using because this is impossible. And so I'm really, really grateful to be here. I have a script that my team has given me, and then I've also got Senator Bergen telling me to speak from the heart, so we're going to see what happens. I'm an Asheville native, born and raised, still live there. Thank you for all your support and help through Hurricane Helene. You guys have introduced a lot of topics here that I've got lots of lived experience with, and I always try to take this opportunity to thank the folks. You're the reason I'm here. And I don't mean that in a small way. I think it takes a whole village, right, to get somebody like me awarded the state, oh, the yellow light already. You know, through these treatments, I was Medicaid, IPRS funded, you guys, so I'm a result of the hard work you do, and I want to take this opportunity to thank you. You know, I wouldn't be here without you. Thank you. That's applause for you. Okay, so that was your applause. Y'all are clapping for yourselves. Okay, so I went to treatment 26 times. How it looked was I would go into the hospital, right? That was the only place I knew how to get some help. I would go there, and a lot of times, I think I went to the hospital at least double the times that I went to treatment and actually made it to treatment. And I remember leaving the hospital, and I would either stay in a waiting room illegally until they kicked me out. And then a lot of times, this happened more than once, I would go and I would sleep in a pile of mulch outside of the hospital, y'all. And it was cold. And my idea was the mulch pile is steaming, you know, so I'm gonna get warm and climb in this soft pile of mulch. First off, mulch is not soft. It was not warm. I had splinters all in my face. And then I would wake up and I would walk around the building and I would go back into the hospital and do it all again, right? And that's what it looked like, because I didn't meet medical necessity. You know, I didn't meet certain criteria, and so they would just discharge me again. A lot of what we've talked about. Let me touch on some points. At one point, I entered one of the facilities that I've been to many, many times, and the director, her name is Pam Burris. I'm still connected with her now, but she pulled me out of my detox room. And she come into the office, she's like, Mike, what do we do with you? And I was like, it's a great question, Pam. You know, I don't know what I'm doing. You know, I don't know how to stop this. And she gave me this list, and she showed me this list. And she was like, out of 50 counties or something, you're in the top 50 users of the state's funds. You know, and I was like, lady, listen, I'm already depressed. Why are we doing this? You know? But could I have been caught
at the times that I went to jail, you know, or like, or in the hospital and I didn't meet medical necessity or whatever, like, could that have been a point to where maybe the 26 times was trimmed down? I think so. I'll let you guys decide that. I also want to say, we talked about therapy, and I was actually talking to one of my people in recovery that I support, and I was leaving my therapist's office, and he's like, what are you doing? And I was like, I'm leaving my therapist's office. And he was like, oh, bro, you go to therapy? And I was like, hold on, stop what you're doing right now. I was like, if you've experienced childhood, you should do therapy about it. That's all. Listen, that's it. If you got to skip childhood, good for you, right? But like, let's all get in therapy. I'm speaking from the heart, Senator Bergen. Okay, so I got some points that I really want to drive home. Today I stand here, y'all, with you know, multiple trips to treatment, in and out of jail, all those things. That's true. That's me also, and I also stand here with over 9 years in recovery, a homeowner. Thank you. It takes a village, for real. And that's the message, right? Like, we don't get here alone. Jacob, man, thank you for speaking. You did such a good job. Okay, let me get to it. My bosses, they will kill me if I don't say these things. And like, I'm the director of outreach for addiction professionals in North Carolina. Like, it's just such an honor, and to be invited up here with lived experience means so much. Thank you for having us. You know, like, I have a GED up here with y'all with doctorates and PhDs and all that stuff, right? This is amazing. Once again, if you're telling that guy that's walking into the state-funded facility, like, Mike, you can do, I'm like, hold up, man. You got some good stuff. Let me, you know. So like, I really appreciate being invited up here. I did some things for over, I think, 17 years in active addiction, right? And like, things that nobody's volunteering for. So I got a PhD, right? But I got my PhD in the streets. So I really appreciate being here. Okay, so addiction professionals in North Carolina, we support, I mean this, all right? You know, we can giggle it up because I'm a big dumb animal, but like, this is real. We support establishing one consistent medical necessity standard based on American Society of Addiction Medicine, ASAM criteria, okay? We support Representative Reeder's efforts to limit prior authorization to ensure people get timely access to critical care. How many times? Come on. Well, it's impossible for me to like think about like how much less pain could I have endured if medical necessity would have been met, and like these prior authorizations and all the things. I'm gonna leave that to y'all's big brain. All right, and then we are working to establish recovery-friendly workplaces across North Carolina because we know that stable employment is a key factor in long-term recovery. Like, it absolutely, I stumbled my way into this, and it took a lot of you guys empowering me. I've met with a few of you this morning. You're like, Mike, you got this. I'm hearing you right now because my imposter syndrome is eating me alive, right? Thank you for letting me be here. And if we can do all of those things, the system can be better. It must be better. And together we can make sure that no one else is left outside sleeping in a pile of mulch. Thanks for letting me speak.
Thank you, Mike. That was powerful. So thank you for sharing. That's really great. Rose, I'm going to turn it over to you for our question and answer period.
I think Mike can do the mic drop. Exactly. So, you know, as you all were talking, I was taking notes here, and I guess, you know, it made me think about. Here we go. A question that came, it was a late coming question. So at the end of last year, the state was able to negotiate a 1115 Medicaid waiver with the federal government to allow substance use treatment to come into jails and prisons. But it will require some state money as part of reentry support. So are lawmakers ready to commit funding to make this a reality? Start right off the box.
We're already doing a lot of it. We started in Mecklenburg County. Secretary Kinsley and I were over in Pitt County last year, meeting with one of the jails. You know, we have so many people that the estimate is 70% of the people incarcerated have both a mental health and a drug problem, and they've been self-medicating. You all know all of this. We talked about it here before. But folks, think about this. We got 31,000 people incarcerated in our prisons and 18,000 in our jails. And 95% of those people are going to be back out sometime. So we're going to have to deal with this either while they're incarcerated or we're going to deal with it out on the street. So it's not going away. They're there. We've been visiting. I had the new Secretary of Corrections in my office this week talking about treatments in the incarcerated community. Secretary Kinsley and I had been talking and visited with folks in Washington about getting people on Medicaid faster before they come out so that we can make sure they have no gap in their treatment. Now, I want to brag on this guy. I met him at October Road. How many years ago has that been?
It's been
3 or 4 years ago. And I told him then, I said, you know, you need to be telling your story. He was, and October Road does a great job, and as a lot of our facilities do. But folks, we have so many people that are dealing with addiction, and you know, I recently, well, last year, everything's last year now, it seems like, but spent time on death row with 3 death row inmates, and folks, you know, hearing their stories, a lot of the stories are the same. Those 3 men that I interviewed, and I'm writing a thing to put out about it, but all 3 of them did not have a biological father in their family. 2 of them didn't even know who their father was, and all of them started on alcohol and drugs at 12 or 13 years old. Then a lack of education, reincarceration, arrest, murders, and they're here, and one of them's been in there 28 years, I think, on death row. So when you look at that, you know, we've got to go back, and I've said to this group before, child care starts at conception. And we've got to get that in our mind and start looking at ways to make sure that we give our children every available opportunity to succeed, not only with the nurturing, the early child care, and I'll talk about that in a little while, but just other things. So Rose, yeah, there's a lot that has to be done. There's a lot of demands on finances now. There's a lot of things changing now. Well, I'm sure a number of us are going to talk about that. But folks, if we don't deal with it one place, we're going to deal with it another place. And then I see my friend Carrie Brown over there, and Carrie hates it when I call her out. But Carrie over there, who is the head psychiatrist for the state, and we talk a lot. We've talked twice this week already, and texted. When I get a call from a county and they've got a 14-year-old that's been in the emergency room since September and has just destroyed the emergency room because of an episode, folks, we can't keep doing this. So we've got a lot to do. A lot of us know about it. A lot of us are working on it. We need your wise counsel, input, and advice and suggestions.
And folks calling, telling their stories, writing, telling their stories.
Every week.
Right. And yeah, so when you're talking then to your colleagues, like they're hearing it, like they like this is now a priority, because it's, I mean, I can't tell you how many years we've been writing about waiting times in emergency departments. Like, so you're telling me that this is now a priority?
Yes, ma'am, it is. And a group of lawmakers, we were all on the phone last week with folks out west telling their stories. We got a whole group of lawmakers on the phone. It was a good way to get people together and just listening to their stories of what they're dealing with. And look, those folks are going through, I always tell people you go through hopelessness, and then you go through helplessness. And they've gone through those stages out there, and so we're really trying to deal with that. And I know the Secretary, we've talked about it, and I know he's got a big concern about it. He's been out there. A number of us are real concerned. We appropriated, I think, $20 million in the last round for mental health in the western part of the county, and we're going to be doing more.
Okay, terrific.
Western part of the state, I'm sorry.
Thank you. This was a question that came in, and then I got a press release that helped me write the question better. So in the last legislative session, we saw lawmakers appropriate dollars to some substance use treatment programs that don't rely on evidence-based care or that don't allow people in those programs to access medications such as Suboxone to help them be more successful in recovery. Representative Reeder, you play golf?
Not in about 10 years.
Oh, okay, because I'm going to tee you up here. So just this week, you announced a statewide campaign dedicated to ensuring North Carolinians can confidently find evidence-based, ethical, and reputable care close to home. Is there an appetite in the legislature to require programs receiving state dollars to adhere to best practices?
I think that's a great question, and thanks for allowing me, inviting me back. I was here last year, so I must not have messed up too bad, so I got to come back. I think the short answer is yes. One of the things that I'm confident in is that the state is really good at spending money. We're really good about giving out checks, but we are not so good at making sure that the programs that we fund are doing and providing what they purport to do. And so one of the things that I talked about last time that I'll continue on, I'll continue to ask questions of, when we fund a program, we need to have an evaluation built into that with funding for that to say, yeah, we talked about this earlier this week, because if we're funding things that work, we should continue to fund them, and we need to look back and say, if this program isn't doing what it's supposed to be, we ought to shut it down. Now, every group that's here that's got a program, I'm sure every one of them will say that they're evidence-based, and my question is, what evidence, and are you following the model as it was done? And if you're not, we got to understand why. But we don't have an unlimited amount of funding, so the money that we spend has to be efficient and effective. And if it's not going to do that, then we ought not to be doing it.
So some of those, programs were earmarks. They were legislative earmarks. So that would mean saying to your colleagues, like, hey, Representative Friendly, like, this program, they're not doing evidence-based care, like. So I think, does that also extend to having the stomach to say things to your colleagues?
Yeah, I think, and we'll start with the programs for the legislators who are no longer there. Those are the easy ones to cut, right? Right. So one of the liaisons in this, we had a great conversation in my first term, and I was saying these same things, and she chuckled and said, yeah, wait till it's your program that someone wants to cut because it's not so good. I think we have to be intellectually honest with ourselves and say, I'm all about experimentation, right? Because sometimes you can't have an evidence-based plan until you have evidence of the program. So I'm really open to experimentation to say, this is a good program, or this is the reason why this may work, and let's fund it. Let's build in an evaluation period, but let's make sure we do that. And I learned, I was at a panel earlier this week, and apparently there used to be some evaluation department in state government somewhere that was cut, canceled, and the way she said it to me, it must have been the Republicans that cut it, so I don't know. But I think we need to get back to that. We need to evaluate what we're doing to make sure that the state government is efficient and effective with our money.
Anyone else want to weigh in on that?
The only thing Thank you. The only thing I'd add to what Representative Reeder said, which is absolutely correct, is that we should apply that same standard at the beginning, not just after you've done it for a year or two or three, but just that's the measurement we should use when we agree to give you the money in the first place. And if that had been done for the earmarks that you're used as examples, Rose, then those programs would not have been funded if we had used that same standard.
Representative Price.
Okay. And I would just add to what both of my colleagues have said, is that in any program, I think it's important to have measurements. You can't manage what you can't measure. And so I think it's important to build those in and also to be flexible. I mean, my background was in planning, and one of the things they always told us about was being comprehensive and flexible, and also looking at long-term as well as short-term, and to build that in. And so rather than just shutting something down, continuously evaluate it and see if you're, meeting your benchmarks along the way. Because, my fear is that if a program is happening, and even if it's failing in some areas, it may be helping someone, and I would hate to see, something to just get dropped, because then you're dropping someone's treatment.
All right, thank you. I'm going to lob you a little softball here. What are you hearing from your constituents about whether, how Medicaid expansion might be improving quality of care for substance use treatment? Are you hearing from folks who are able to get access now?
I'll tell a real quick story. We had, I still am on the board of Central Carolina Community College, and I'm chairman of the finance committee, and the president of the student body is on that board, and he was sitting next to me right before expansion went into effect. And we were talking, and I knew something was wrong, and I said, tell me what's going on, and he said, I can't afford to buy the medication that I take, and I'm probably going to have to drop out of community college. And I said, well, are you not on Medicaid? And he said, no. And so we started talking, and then I made a couple of phone calls and found out that he actually was going to be eligible under the expansion program. So he got on, he was able to stay in school, he was able to complete everything because of that. But I'll give the warning that I always give when I talk about Medicaid. We've added roughly 640,000 people to Medicaid in a year and 3 months. We estimated it'd take 2 years to do that. We're over 3 million people on Medicaid. That's going toward a third of our population. Folks, if we don't have a plan on how to thoughtfully and get people off of Medicaid into some kind of employment. And I'm not talking about the children, I'm not talking about the disabled, I'm not talking about the elderly, I'm talking about people, and a lot of the people are working that are on Medicaid, and I always say that too. But we've got to do a better job of getting them trained. Now, Cody and I have talked to Washington, and we've been on conference calls. We've asked for a waiver, didn't get approved, asked for a waiver to be able to use Medicaid dollars to pay for community college and child care for people that are on Medicaid to get them into better paying jobs. I think if we do that, then we have a path to start depopulating a federal program. I don't think it's as a Christian and a believer, I think people are much happier if they can take care of themselves and their family. There is a basic belief and a basic feeling in someone, especially men, of being able to provide for their families, themselves, and provide for security. And I think we're depriving people of that in some of our programs. So I think we have to approach programs in a smart way, not to take stuff away from folks, but to empower them to be able to do things for themselves.
But as you say, 70% of our expansion population are already working. So
yeah, they're underemployed, and a lot of it's because of education. Mm-hmm. Just like the guys I was talking about in the incarcerated community. If any of us could go back into those men's early childhood, and I sit with them for hours and just listen to their story, and I was thinking, at that moment, if someone had been there, a mentor, a peer, someone, but mostly a mentor or a parent, that would have never happened. I don't think any of those three that I talked to, if someone had intervened in their early issue, that they would have been on death row. And I think there's some people that, for whatever reason, that wouldn't apply to, but I think by and large, having someone in their lives and especially getting an education. I'll tell you another interesting statistic of everyone that's gotten in North Carolina that's gotten a degree, an undergraduate degree, while incarcerated, only 7% of them have gone back to jail. Mm-hmm. The ones that have gotten a master's degree, we've never had anybody go back to jail. Mm-hmm. So I always say we just need to get everybody a master's degree and nobody would be in jail. So. You earn it, that's right. And I always say that, and everybody always laughs, but just what does education do? It gives you options. And I think that's what a lot of people don't have in their lives is options.
Right. I'm going to follow up with you on that offline here. But, we've had a historic investment in mental health services and substance use services and programs in the last legislative session. However, it's one-time funding. And whenever I'm someplace and, I always mention to people, I feel like the skunk at the garden party, well, it's one-time funding. And so here's my question. What steps are being taken to maintain funding for mental health services, since we initiated all these great new programs, and or maybe increase funding for mental health programs or substance use programs, particularly in underserved and rural areas? Any takers?
Yeah. So I think some of it was one-time money, but some of it was recurrent. So we raised the rates for providers. A lot of the people in this room got increased reimbursement rates that hadn't been done for a long time. So that's not one-time money. Some of the one-time money went to build capacity for crisis services, so behavioral health urgent cares. I know that we're getting ready, I've just learned in our county later on this year. So some of that money is startup funds to get the building built or staff hired. We need to make sure that the model that we build is actually sustainable. And whether that's funding ongoing from the legislature, whether it is expanded Medicaid, or whatever that funding source is, we need to make sure that they are sustainable. And so, great question. How do we take this, what was one-time money, and build a more sustainable situation? And some of it, the folks in this room have to figure out, as we were talking about before, how to make sure that the program that they're running is working and it's cost effective. And so I think that's going to be the challenge for us moving forward. Historic investment, but we've got to figure out how do we continue that.
In other words, it's really useful for programs to do, to calculate their return on investment.
Absolutely, and their outcomes. We talked about measurement, right? And I teach a lot of QI. What's your, there's an outcome, right? Are you alive or dead? Are you sober or not? But we have process measures. Did you get to your meetings? Did you fill your prescriptions? So if there's a program out there and you're coming to meet with me about increased funding, here's the question that you better be prepared to ask is, here's how I'm going to measure my success. This is how we've done it in the past. And the measure can't be, this is how much money we spent. Okay, that is not a good measure for me. It's great, but if you take the money you spent and I divide it by the number of people you served, that better be a good ratio. But I also want to see what are the clinical and really outcomes on top of that.
Okay, great. So how are we utilizing the opioid settlement funds? So here's one source of money. How are we utilizing opioid settlement funds from the federal and state settlements to improve substance use services across North Carolina? And maybe talk about what new initiatives are being rolled out, pilot programs, residential programs, incentive programs. Anyone have?
Well, you can look right at me, Rose, since I asked you to ask this question.
I was going to just sort of like play like that.
This was actually y'all's question, and when we were sent the questions in advance,
although I've gotten some new ones.
Agreed. But when we were sent some of the questions in advance, this one really spoke to me, so I actually did a little research, and so I just want to say a couple of things. First, a point of clarification that the national opioid settlements were not federal or public funds. Instead, the result of many lawsuits with private companies who both produced and kind of pushed out there these drugs. So North Carolina will be receiving, over the course of 18 years, $1.6 billion in installments, and we're effectively in year 2, and currently 2 or 3. The funds are front-loaded in the first few years. Governments do not have to spend the money in the year it was received. Funds do not expire, which is really important.
Senator,
I want to say one thing.
I just want, and those funds, are they in a lockbox, or can they just get spent any way they want?
I'm sorry, say that again?
Are they like in a lockbox, Or can they get spent any way lawmakers
Hang on,
want?
I'm getting ready to tell you.
All right.
Thank you very much. So here's why I'm really proud of North Carolina. I don't know what other states have done with their settlement funds, but here's what North Carolina's doing with ours. And this speaks to the evidence base and also to where the services actually get delivered, which is on the ground. So of the funds coming to North Carolina, 15% go to the General Assembly. I believe they're appropriated through DHHS, but 85% of the funds go directly to local governments. All 100 counties and 17 of the largest cities. Some cities have chosen to give their funds actually to the counties. All funds have to be spent on opioid remediation abatement activities that stay aligned with the National Settlement Agreement. And I'm going to tell you, rather than just giving you the fish, I'm going to teach you how to fish. So there is, you can go to, I'm trying to find the website here. Okay, you can go to the ncopioidsettlement.org. That's a North Carolina website that will tell you everything that's happening with this money. And you can actually search by county, your counties where you deliver services, and it will tell you exactly how much money they got and the programs that that those funds are funding. And I think that's really important. And they have a list of 12, something like that, but there are 5 top ones. I'll tell you just real quick. So recovery support services to connect people to peers, community distribution of naloxone, collaborative strategic planning to support staff to help meet the requirements, post-overdose response teams, and evidence-based addiction treatment, which must include access to medications for opioid use disorder. I think we can be very proud of what North Carolina is doing with all this money.
And I would just like to add to that, I did spend 10 years prior to this as a county commissioner and was a county commissioner when the opioid settlement was happening. And I know that, of course, Orange County, we came up with our own program, but the North Carolina Association of County Commissioners, I owe a lot to them, so I still sing their praises. They also set up a way to help some of the smaller counties to utilize these funds. And so that there should be programs in every single county, and if there's not, there is help available for that.
We've definitely, when we hear from other states, even at our publication, people saying, "Wow, in North Carolina, you're the model. You're doing good stuff." So it is actually pretty exciting. So thank you for doing that research, Senator Adcock. Housing's a huge, going back to the first pillar, but housing's a huge problem for people who are in substance use treatment programs too. What can we do as a state to make it more possible for these folks to be successful as they're trying to recover?
All the things that you heard before. No, I mean, we had a great discussion, and I think, it's local zoning. It's, from my point of view, partnerships, public-private, to do development. Is there tax credits that if a developer is going to put up a place, is there some way that we can make some affordable housing attached to that? And if we need tax credits, and I heard very clearly that it hadn't occurred to me, and maybe it should have, about the limitations on people getting leases if they have substance abuse on their history. So that's something that I think we need to look at.
I think one of the, I'm so sorry, Renee, go ahead. No, you. Go. You can't out-nice me.
All right, okay.
Renee, go.
Okay, yeah. So I think also reducing the stigma around housing, because, we hear so much about people, I want to help, but then when someone says, well, let's have, some alternative housing next door.
Right down the street.
Yeah, then, people start crying, or complaining. But I do think that we need to think about housing and making sure that we have services that are accessible wherever the housing is. You've got to be able to get to work. You've got to be able to get to your health appointments, to go, do your grocery shopping, whatever. We need to have all of those, the wraparound services and all the other services, just like anybody else, available, and transportation is often a barrier. So that's why, having some, being able to locate housing and find housing in urban areas or in a small community really works. The problem right now is that in most of your central cities that are revitalizing themselves, the property, it's expensive. It's prime real estate. And so we've got to figure out some kind of a model to allow housing for everybody in urban areas.
So I'd like to give you something to think about. It doesn't cost any money. It's all policy. That should make us all happy. And that is, as having come from local government before I served in the legislature, I'd like to see our General Assembly more attuned to not creating policy that impedes counties and municipalities from doing these creative things that can increase affordable housing, whether that comes to zoning, transportation, land development, or whatever. Sometimes we are induced at the state level to pass a policy that applies statewide that actually gets in the way of the people in the community who know where the transit areas are going to be, who know what resources they have from meeting the needs of their community. And we can do that. It doesn't cost anything. What it takes is a listening ear and to actually think beyond the moment to how will this impact all of our municipalities, and actually talking to the league and the Association of County Commissioners and things like that before we pass those proposals that sound good and would help one person but hurt many.
So that looks like Mike wants to say something.
I do want to talk. Okay, so I navigate this often. This is boots on the ground experience. My suggestion is to fund it. I navigate folks all day and they call me and they're like, Mike, I'm leaving treatment. What do I do now? And I'm like, okay, let's find you a spot. And then that spot is, $1,000 a month. And I don't know, but when I left treatment for the 26th time, I left with the clothes on my back, and I didn't have any money or anything. I had to beg and do all these things, right? And I was homeless for 2 weeks before I got into housing. And luckily, what is now VIA, it was called Smoky Mountain at the time, gave me a $300 grant to get in there. But it was such a challenge to navigate, and I had to call all kinds of different folks and all these things. So what I do now is connect folks to different grant funding sources. But it starts there. Housing costs money. Everybody in the world pays rent, and so and I provide sober living, and I do my best to be as affordable and offer scholarships and all that. But as folks call me for help, how do I get them into a place for free?
So, so this begs the question for, it looks like Senator Bergen wants to say something, but maybe as you're answering, you could talk to this a little bit. What can people in this room do to help your colleagues? You all seem to get it, right? You're here, you're engaged, you're willing to be put in the hot seat. What do your colleagues need? Obviously, they're having conversations with you, right? And I'm guessing that as you said, that they're seeing things like the ED problems. But what do they need from folks in this room?
We've got to make it easier. The calls that I get during the week or at night or on weekends. I expect to have a call this weekend about something that's going on, but people will call me, even people that are in this world, the healthcare world, and we've so ingrained 911 is a number to call, and now 988, but then there's all these other different numbers. But most people don't know where to go to get services. We have almost made it a maze. And I think it's because we've got so many different wonderful people out here that are trying to do things. But folks, we don't need to be starting up more programs. We need to be building the programs out that are working and trying to really, some people come to me regularly at the legislature and say, I've got this great idea, I want to start this program, I only need $4 million or $8 million, and literally that happens almost every day in my office. And I tell people, who's doing what you're doing now? And they'll say, well, such and such is doing it there. I said, well, let's talk to them and see about doing it. But folks, we need to come up with a way to where anybody that has a problem, because what's going to happen, it's going to be a night, and something's going to happen to a child or a friend, and you're going to get a phone call and they say, you know, they've had this event, the police are involved, what do I do next? And that's what usually happens. The police are involved, and then the next thing they go to the emergency room, and which is the most expensive place for them to go. We were talking about funding. I can drive $250 million of money out of the system if I can keep people out of being involuntarily committed that don't have a medical need to be there. So think about that. That's $250 million that we could be spending on services. And then, of course, you know, the emergency room's the most expensive. The psychiatric mental health hospitals we have are very expensive. So you know where they end up lots of times? In our jails, which are the least expensive. So you were talking about affordable housing. Sometimes that ends up being our jails because we don't have any other place to do them. I had the Secretary of Administration also in the office this week, and the state owns over 12,000 buildings. So I've asked the question, how many of them are vacant? Well, we're not really sure. So we're going to try to get a list of all the vacant buildings and all the buildings that are being underutilized across the state. I've also talked to all the county commissioners. I met with the Kevin Leonard from the Association of County Commissioners. I met with the presidents of the community colleges, and I've challenged all of them. Tell us every space that you have empty, because we need to be utilizing space that's already paid for. Let's don't go out and be building millions of dollars of new space when we got space. So if you all know of, and now this is I love to give people homework. This is your homework. If you all know of buildings in your counties or cities that are owned that aren't being utilized, send it to me, because we're trying to develop, I want to develop childcare in those facilities. I want to develop housing in those facilities. And I've talked to my friends at DHHS about coming up with ideas on rules and regulations that I don't want to put people in harm, and I don't want kids being around lead or asbestos or any of that. But some of our rules make it really hard to use existing buildings that I think if we just relaxed a few things and made a few adjustments, we could get people in a better place. I don't want people, when we first met, they were telling me about people in Asheville that they were going to see that are living under bridges, right? And we talked a lot about that and about, you know, why. And a lot of it is mental health issues, but a lot of it is there is no place. I went by one facility, and this was not recently, not since the storms up there, but I drove by an empty lot, and there were probably 10 tents. This was in Asheville, set up. And I asked about it, and they said, yeah, we've got some people that live over there. And that's not good. That's not healthy, and we don't want that for people.
So I'll answer your question. Oh, was somebody? Okay. I'll answer your question about what can y'all do. And that is get to know your own House member and your own senator. Invite them to the place where you work and show them what you're doing. And if you can either come to their office and meet them that way or invite them there and let them hear stories like Mike and the other gentleman this morning shared, so that they can see this happens to everybody and what can be done with the kind of services you provide when communities come together and people can go on to live great lives and be, you know, tax-paying citizens, contributors to society in big ways. That's what then will move the funding. That's what moves hearts and minds, are those sticky stories, and you know them all. So that's what I would commend to you.
Yeah, well, I think a great example of that is Healing Transitions in Raleigh. They query, for folks who know, they query all of their graduates every year, and they ask them how much they paid in, you know, local, county, state, and federal taxes, and then they aggregate that. And so then when they come to you, they're able to say, oh, this is what our graduates have been able to do, right? So, yeah, the ROI is important. I think that's it on time and on questions too. So thank you all very much for allowing yourselves to be in the hot seat.
Thank you to our panelists and to Rose. And let's take a moment and give all of our speakers today a big round of applause. Thank you again to our sponsors. We really love the eggs today, so we appreciate that. A big shout out to the Friday Center staff. We could not pull this off without the great team here at the Friday Center. Let's thank them. To our planning committee, another remarkable job this year, and we just so appreciate all the work behind the scenes. Well, we've heard from experts in various fields. We've heard from individuals and about their lived experiences, and from our legislative leaders who are committed to making continuous improvements in services around behavioral health. So as we leave today, let's not let the passion and energy diminish what we start doing tomorrow. Remember to check the digital program for all the biographical information on these incredible speakers we've heard today, and to provide feedback on the event. Our steering committee loves to hear from you. And keep up with the breakfast website and Twitter feed as they provide information throughout the year. That's a wrap for year 47. Be sure to stay tuned for the dates for the 48th Legislative Mental Health Breakfast, slated for February 2026. Goodbye and drive safely.